Don't be left behind this AI revolution in healthcare. I put my best advice, thoughts around AI and healthcare over the last year and a half. Hopefully this information will be helping you to get to the next level when it comes to understanding how you can implement it in your organization today. We go from understanding ChatGPT and Claude and how they're different, understanding all the ins and outs of AI. Then we also talk about how to actually deploy it and use it inside your organizations. And then we get some interviews, practitioners using it in their day-to-day. Let me know in the comments below if you like this type of content. We'll provide more in the future. If you are new to this channel, my name is Theo Harvey, and I'm the CEO of SensorMed, the AI-powered remote care as a service platform for healthcare organizations. I consult with hundreds of medical professionals every year to guide them on best practices and implementing AI solutions and workflows in their current operations. I have worked with large organizations like Cisco Systems, AT&T, the Charles Barkley Organization, Blue Cross Blue Shield, and Google. And my mission is to help healthcare professionals prepare for the new normal in healthcare before it's too late. There are several different solutions to these issues that are coming up again and again when it comes to patients' usage of AI. With the growing reliance on AI tools, patients are grappling with rising costs, access to challenges, administrative complexity. All these things are just driving patients toward using artificial intelligence. And so I think that AI is helping patients with these rising costs. And if you want to know how that is, we did a whole video on how AI can help fight denials. You can watch it right here. But this AI tools are really powerful, and that can help patients with that. So I would encourage you to understand the tools and how patients are using it and guide them on ways they can fight denials if they're getting it, or help with prioritization, because that ultimately will help your patients who are doing it on their own anyway. But more importantly, that creates that stickiness that gets you closer aligned to them. Second, patients have demanded for information when provider offices are closed. That's so key because access is so huge. If you have a pain, you need help with it now, then you want to get answers now. And a lot of clinics and offices are closed after 5 p.m. But now you can stay open anytime. Embrace those AI tools that answer calls after hours that not only are just phone trees and to leave a message, but actually has a FAQ, frequently asked question database, that's feeding into. So questions that patients call after hours, they can get answers to them, right? And then tie that in back to you, and maybe you can help them right then and there. People want fast answers when they're in pain. Now, here's another tip. If you live in hospital deserts, locations more than 30 minutes of drive from general medical or children's hospital, is so very important to find a way to connect with these patients because they're looking for help. And matter of fact, in the study, ChatGPT said that they found that there was a lot of patients asking for help that were in these hospital deserts. One tool we found that can help is remote care as a service programs that provide blood pressure monitoring, glucose monitoring, and connectivity back to a clinician at a timely manner is super helpful in making sure those patients who live outside or in those hospital deserts get more connected to their patients. If this is something of interest to you with this kind of remote care as a service type program, look, we have an offer. So go check it out and link below if you think it can help you, your patients, so they still feel connected to you, even if you're not around. So now I'm going to tell you a little bit about how you're kind of using AI for tasks. As a healthcare professional, obviously you see the importance of using it for documentation, administrative work, diagnostic support, and even helping manage burnout. But there's one way that's super helping is for charting, which is ties into that documentation, administrative work. And we talked about it in detail on the next video here. So if you want to look at that, check that out. But using these kind of AI scribe tools will be helpful in helping you manage the patient administrative load. And so you can do what you do best, which is take care of patients. Richard Branson, entrepreneur, Virgin, and other type of enterprises said, you don't learn to walk by following rules. You learn by doing and by falling over. I would implore you to start to use the technology tools you have now more and more so that when you start using them, you feel more comfortable and you can help your patients in those areas of access and affordability for the long term. I'm going to encourage you to take the time to embrace this technology and get better at it sooner than later. Why? Peter Drucker, famous management consultant, said the greatest danger in times of turbulence is not the turbulence, it's the act with yesterday's logic. Turbulence is here, and you can't go by a traditional way of practicing medicine. You have to go by today's logic, ideas, and technologies and innovations so that you can execute more effectively with your patient populations. So I would say this, don't hesitate. Please start to get up to speed with the artificial intelligence tools for your patients so that you don't get left behind when they're looking for other solutions and options. Before I get into that, if you allow me to take a moment to provide you with a brief public service announcement. We notice about 84% of you watch our videos but are not subscribers yet. If you can do me a big favor and take the time to subscribe, as that will help the algorithm reach more people like you. As healthcare is rapidly evolving and changing, we all need content like this to adjust to the new normal. Now back to the video. The thing about artificial intelligence tools is that the first level in using them is so easy to understand. It's just a simple tool where you have a specific problem you need to solve. So for instance, I need X, so I'll push this button to get this output. For example, I need to put up a painting on the wall, so I use a hammer to hang it up. But the next level of AI tools is to think of them more as human beings who have some agency, but they may need a little management. Think of it like an eager intern or a new employee. In healthcare, think about how you bring on a new medical assistant or nurse. Yes, they have knowledge about healthcare delivery. This is the what to do of their job. They also have the skill. This is the how to do the job. But they have no idea how your specific medical practice or clinic is run. A quote from Benjamin Franklin says, "Tell me and I forget, teach me and I remember, involve me and I learn." Human beings need context in order to apply knowledge and skill. They need to understand the why of what they're doing and how it relates to everything. I remember a time when I tried to teach my daughter fractions. Anyone who's a parent knows that frustration when helping your kid with homework. 1/2 plus 1/2 equals 1, right? You say that over and over again, they don't get it. So you say to yourself, let me just say it again, but louder, hoping they would get the understanding with just enough volume. So you know what? I switched strategies. I started to talk about cooking, which she loved. I showed her how this recipe calls 1/2 cup of milk for 2 people. But if we want to make the recipe for 4 people, how many cups of milk do we need? She said 1 right away. It wasn't until I gave an understanding of why we use fractions, in this case cooking, that she was able to give me the correct answer. Human beings need context in order to apply knowledge and skill. Likewise, AI needs context in order to apply its knowledge and skill. So if you want to learn how to add context to your prompts inside a tool like ChatGPT, simply create a Word document that has all the particulars of your situation. For example, in my business, I put into information about the type of patients we service, how we service them, what it costs us to service them. I do all this without adding any protected health information. So with this context, my AI, or in this case, smart intern, now has better context to give me better answers when I ask questions about my business or how better serve my patients. Artificial intelligence is smart and give you answers so quick. But here's the secret. It gets things wrong all the time. Artificial intelligence has a tendency to do something called hallucinate, which I think the technical term is make up stuff. A 2025 article in the Journal of Medical Internet Research said that when the top LLMs, or large language models, were given a task to create top reading lists of research papers across the world, they found that either the title, first author, or year were completely made up. So if we look at the case of ChatGPT 3.5 at the time, around 40 out of the 100 on the list were just made up. That was around 39.6%. ChatGPT 4, a little bit better percentage, around 28.6% were made up. Google Bard, 91.4%. Why is this happening? Well, I believe the essence of AI, ChatGPT, and other LLMs really language prediction models that predict that a word should come next in a sentence based on data. This is something that they built into it. It's a feature, not a bug, because they want it to have a better understanding of language models and what should be said based on the data it's ingesting. That's why when it responds and it sounds reasonable, even if the information is accurate, because it has great data on exactly what should be said in that context. Here's what you can do to stop it from hallucinating. Let's do a little demo. I'm gonna put in here and give it a question to ask. I'm gonna say, give me data on how many older patients use blood pressure devices at home. As you can see, I said cite their sources, because if you can have it cite its sources, you'll be able to check the website data for yourself to see how accurate the information ChatGPT brought back to me. Next, after I get the data, I would then ask how accurate this information was. As you can see, you're amazed at how honest ChatGPT is, what it did and did not do in order to provide you with this answer quickly. This is amazing about ChatGPT. It's really built to kind of give you the best answer quickly, but also it's very pleasing. So because it wants you to use it over and over again, just like any technical tool. But again, if you want the right answer, like President Ronald Reagan said, trust but verify. So as a reminder, when you enter in a prompt, remember to have it cite its sources and then ask the AI to check its work after the fact. Let's talk about innovation. What does innovation mean, right? Definition says to implement a new or improved idea, product, or solution to create value or solve a problem. Absolutely, everyone kind of thinks about the product or solution that you're creating to create value, to solve a problem. But I think there's a hidden story here in this definition. And that story is implementation. That's the hidden word that we're not looking at. This is what makes innovation real, is the actual implementation of doing it at scale. So I like to give an example of Elon Musk. He talks about this when he talks about his first principle thinking. Basically, that means getting an essence, something down to its components, right? And breaking it down so you can reconfigure them and think differently about the problem so that you can actually implement something that's real. The use case of this would be, he was looking at battery costs for the Tesla. The assumption at the time were battery packs cost around 600 kilowatts an hour. Fundamental truths around that was that the batteries are made of cobalt, nickel, and aluminum. So he was trying to figure out, how can we get battery costs down? He determined that the market value of these new materials, and he found clever ways to combine them into cells to create much cheaper batteries. Therefore, historical cost expectations were blown out the window because he was able to configure them in cheaper formats, because he just went down to first principle thinking. And that's so key. When you kind of think about innovation, I like to kind of think about the actor's process. One of my uncles is an actor. He kind of walked me through his process of what that means. What does that look like for him? So it's not just about the words on the page, but it's like, what is the words inferring? So for instance, it says that he walks with a limp. How did he get that limp, right? Does he walk with that limp with pride to show that he was tough at one time? Or if he has a slight stutter, what does that mean about his background? Was he embarrassed about that stutter? So when he gets excited or angry, that stutter comes back up and he looks a little bit embarrassed by that stutter. You could do so. So that's what he talks about, the actor process, creating a character out of words, a person, a human being, a three-dimensional person just out of words. And I think that's the way I want you to kind of think about innovation. You need to have a process on how you do it. And I think that's so important as we kind of go through the framework I have built on how to make innovation real for your organization. I like to call it the 4 F's of innovation. The first one is foundational actions. This is when you focus on those first actions that get toward the implementation faster. You want to make sure that first idea, that first thought, get it out fast. Also, you want to make sure you have enough resources to execute those foundational actions. Doing the research to understand what's available, what's possible. Those foundational actions are so key to getting that first step of innovation, which I talked about, which is implementation. Implementation at speed. The second F is fail fast. It's a quote from Mark Zuckerberg: you want to move fast and break things. In the world of artificial intelligence and social media, you can test ideas so fast now. It really makes more sense to just go ahead and test it out, see if it works, and then fail fast. Because guess what? The learnings are happening faster and faster. And that's something that's super important in this day and age. I like to talk about Google. They had a 70-20-10 program years ago, and I think they still have it today. And basically they talked about like 70% of your job tasks should be really focused on the core project. For instance, if you're working on Google Gmail, that's what you focus in on. The 20% is related on adjacent projects, right? So anything that helps Gmail will perform better, right? Maybe a messenger service or something like that. Just some kind of communication process. The last 10% should be truly experimental. That means doing something outside the box, right? So instead of just communicating via words, can you communicate via pictures, right? And thinking outside the box. This is so key to drive and get to that fail fast process. It's about experimentation. So think about your organization. How much room are you leaving for fast experiments? Third F in the 4F foundations of innovation is feedback. I like to give an example, group of blind men, right? They're walking in the jungle. They kind of stumbled upon this object. The first person whose hand landed on a long, thick snake, he thought. He said this to his other guys. Another one would reach for something and he said, guess what? Feels like it's some kind of fan. The third blind person kind of walked upon and put his hands around a big pillar. He said, I think this is like a tree. And the fourth one kind of felt and something that was hard and smooth. And he said it was like a sphere. They each had different pieces of the elephant they were touching. So they thought they were touching unique different objects, but they were actually touching the same object. And that's the importance of feedback. Great feedback gives you a complete picture and removes blind spots. Let me say that again. Great feedback gives you a complete picture and removes blind spots. And finally, the fourth one is follow-up. That is so key. Tons and tons of times I tell my team deals are lost in the follow-up if you're doing sales. Follow-up is so key because it means that is an important thing that you want to make sure is getting done. So making sure when you have an innovative project, a lot of projects fail because there's not enough follow-up. And so making sure you implement that and making sure follow-up is done is so key to meet that fourth and final F when it comes to innovation. Context matters. Context is huge because the artificial intelligence still doesn't understand human interactions, right? It doesn't understand when you give it a prompt, what goes behind that prompt. Why are you even asking that prompt, right? And I think it's because someone made a great analogy to me. It's like, think about business consultants or other huge consultants. What do? There's knowledge is free. Anything you want to know in this world is out there on the internet. But what do? They go find the knowledge that you need specifically for your problem and help you with it. It's almost like they're in a wood and there's a flowing river and the consultant comes with their tin cup, dips it into the water, pours out a cup of water, and then gives it to the person and charges them $20. That's right. Knowledge is that river, the knowledge of the world. And that cup is what that consultant believe will be the most impactful for you when you need it. So basically, what are you paying consultants for? What are you paying human beings for when they interact with AI? Speed, taste, judgment. This is stuff that the AI can never have, right? Because it's not the picker. It doesn't understand it. It just does what it's told to do, right? It has an objective and achieves that objective. But who makes the objective? Why is the objective important to know? How does the objective fit in the context of other things that are trying to happen? So human beings will always be important when it comes to context and understanding how to use artificial intelligence. Community matters. Community to me means human interactions in an environment where they're seeing each other, because human to human relationships still move the needle drastically. Yes, agents, AI agents that are coming are going to be able to communicate and do their own thing. But still, trust is huge when it comes to human connection, because if there's no trust, there can be no work. And there's no trust, there can be no scale of that work. In my opinion, trust is the glue that holds human society together. Think about it. Laws, they're based on trusting that people will follow them. Every time you get on the highway, you trusting that the next person will follow that stop sign and not barrel through the lane and hit you on the other side in a car. Likewise, we're all dependent on each other and trust each other to follow certain sets of social norms, legal norms, societal norms. And I think this is so huge because AI doesn't have that understanding. So when you have a community, people meet you, they get to see you, they trust you, right? They start to know you, they start to like you, and they begin to trust you. That's the levels of human interaction. So when you have a community, this is what means when you can grow and still understand how to use AI to affect the community more positively. This is one thing I want you to think about. How are you building your community now? Are you out there? Are you on social media? But more importantly, are you meeting people in real life, actually talking to them face to face so they can see who you are? You're a human being going through this human experience, right? I think that's so vitally important in this age of AI that we don't forget that community still matters and that people communicating with people is going to be the thing that's going to help us thrive to the next level of humanity. Communication matters. Yes, the AI can come up with all these great tools and resets and all that, but at the end of the day, it's still machine. You still need a human to communicate what this means to other humans so they can accept it. Remember, I talked about trust in the community setting. In the communication area, it's all about conveying that trust. How are you allowing people to understand and get buy-in so they don't feel steamrolled over? Because you can only move a massive amount of people if you can communicate well and they understand the context, what AI is giving them so they can move as well as one. And I think that's going to be hugely important. Invest in the skills to communicate better. Invest in the skills to understand human connection. How do you transfer feelings and knowledge to other human beings, right? Especially in this world of social media and AI, where we have these what we call parasocial relationships. Basically, people are watching videos all the time and they feel like they have a relationship with that person, right? Some of you may feel like you have a relationship with me because you've been watching my videos for so long. But again, the human communication is key. You have to be able to convey concisely and with conviction what it means to move forward with an idea that AI has given them. This is some of the things that I believe healthcare organizations are struggling with right now because we're seeing the rise of AI being used for clinical decision making, right? Started years ago, radiologists. There was a vision that radiologists would be out of the job. They would not be able to look at the readings, look at the images, and get back to the healthcare systems fast enough because AI would take all that, right? It would process the images faster, send the results, and give it back to the clinicians back in the hospital. But what we've seen is the opposite. Radiologists are thriving. Yes, they can watch images from home, but that human in the loop, if you will, that doctor that's looking at the images, still important in the whole process. So that tells you something about, can healthcare use AI for decision-making processes? And I would believe that no, not right now. So this is some of the things that is really driving. I just recently had the opportunity to go to the Vive conference, which is the largest health IT kind of strategy conference in the world. It was recently in Los Angeles, and there was a lot of topics around artificial intelligence and its use in AI, right? And so we're going to talk a little bit about that and seeing some ways you can kind of implement in your organization. You have to use it as a leader. That's usually individual contributor, doing the basic emails, playing with it, kind of understanding it. As a strategic leader, you need to embrace AI and use it as much as possible. Yes, for your emails and all that, but have you truly automated some of your processes using AI? Have you looked at agentic AI, which is basically AI that runs autonomously without you kind of looking at it over the shoulder? Are you've done that yet? Individually, that's where it starts, right? As individual strategic leaders, you have to embrace it. Currently, how I'm using it. Number one, I'm using it to do all the basic stuff, right? To kind of reach out for emails and commenting and things like that. I'm also starting to automate it, right? Using tools like N8N and others to kind of automate my processes so they're automatically done for me. So for instance, a lot of my social media content is driven by AI, right? Taking a piece of content like this long form video I'm doing today and parsing it out so that multiple people can see it. One of the things also I'm using it for is to kind of help frame some of my decision-making processes, what markets to get into. So that's more like decision-making. So I'm really embracing it. And so now that's the first level, right? The individual contributor, understanding what it means to kind of use it and then kind of implementing across the board. The saying goes that you have to start from the head, right? If you're not looking at the beginning, if you're not the strategic leader that's understanding how to use it, how are you going to teach your other folks, right? You can only lead by example. And this is some of the things that are important and starting with my organization. So definitely take that first level. AI can be used to really personalize things. So what does that mean? You can definitely use it for clinician decision-making and all that, but it's really important to make it personalized, right? So what does that mean? Make it optimized to your context. Understand your back history, understanding your context around how you deliver care to patients, understanding the way you talk. All the things that go into it to make it personalized. Why is that so important? Because AI is driven by context. Let me say that again. AI is driven by context. It can only deliver what you tell it to deliver. If you don't give it anything, it's going to make assumptions or do things called hallucinate or drift away from your original purpose. Why does it do that? Is because it doesn't have your context. It doesn't have your decision-making process to understand why you're asking these questions. The more context you get AI, the better it can perform. Because if it's not, it's going to, again, if you've seen some of my other videos, go check out my video on where I do a deep dive on how ChatGPT works. That video really kind of walks into like how these chatbots and how AI in general works. It's basically a prediction engine based on all the knowledge of the internet. So it may give an answer that's quick and sounds right and is probable, but it doesn't have the context of where you're coming from. So yes, it's getting information from the internet, but it may not be the right information to what you need. So that's why you have to feed it with so much context, right? So that it can get the right answer and really become something useful for you. So absolutely, you want to make sure AI is personable. Now, the next layer, like I was telling you about, is making it personable, but not just for yourself and using context around that, but for delivering to your patients. So you want to use it for patient care, right? I get that part. But have you thought about what that looks like from a patient standpoint? They're getting a call, a random call from AI bot that's talking to them, is not really listening, sounds artificial.
It's not asking about themselves.
As a patient, they're going to click and hang up immediately. We're seeing that time and time again. Even if it's a text message that seems automated or not human, healthcare is human. Let me say that again. Healthcare is human related. You have to have humans talking to humans at the end of the day. Yes, the automation can help or the AI can help with triaging, but there always has to be a human in the loop to be able to communicate as a human, because now there's a shared understanding of what it means to be human and what that pain means that the patient may have to go through. And second, you want to have the human in the loop to deliver news that may not be in the best light, or bad news, if you will. Because if you didn't know anything about artificial intelligence chatbots or just any AI large language model, they tend to be very affirmative, right? Encouraging, very rarely deliver bad news. And guess what? That's a feature, not a bug. Let me say that again. That's a feature, not a bug. These large language models were built in order to be more congratulatory, more helpful, more positive. Why? Because the builders want you to use it more. So if it's more encouraging, if it's giving you great ideas and gets you in this, what they call AI psychosis, you're going to use it more. And if you use it more, the makers of this tool, they can drive up their valuations higher and higher, as you've seen in the media with OpenAI raising billions and billions of dollars, right? Probably on its way to be the first trillion-dollar company just based on what it raised in money. So I'm telling you, this is kind of where it was built for. So that's why you need a human in the loop to make sure you eliminate that kind of hallucination and that non-puffy kind of talk so that it can get straight talk to you. So we talked about the first layer, which was about individually using it. We talked about the second layer, personalization, or really doing context, why you need to do it now. Why is it so important to execute now? Other organizations are using it. If you're not using it, you're going to be falling further behind. But more important, it's not just about using it, it's about using it in your context, in your workflows. Because the more you use it, it's like riding a bicycle, the better and better you get at it. And more importantly, you become more efficient. I've been using AI for the last year and I've seen my productivity just explode. Literally right now, while I'm doing this recording, I'm having AI send out content, send out emails, reaching out to my team while I'm doing this. As human beings, we're limited by time and space. We can't only do certain things. But because AI is constantly running in the background, because it never sleeps and it does what it's supposed to do, you can have it move a lot faster than you can, and you can be way more productive. Why is that important? Because humans with better tools always beat humans with lesser tools. Let me say that again. Humans with better tools always beat humans with lesser tools. We are seeing more and more clients making the switch in their choice of large language models, or LLMs, from ChatGPT to Claude. But you know what? Unlike other tools, when you make that switch, there are fundamentally different ways to work with AI that require just a mental shift. No one is talking about this, but those who have a framework around, first, working with these advanced LLMs, and second, knowing the difference between them, will unlock tremendous value in their day-to-day operations. Why is that? Well, because each of these tools behave differently from the same inputs. And the key with any LLM is to get to behave in a predictable manner, especially in healthcare, where one bad output from an AI result can result in life or death decisions. It's important to understand why you need to use another solution, because any movement will absolutely cause pain due to what they call switching costs. Switching costs happen when you have to use time and energy to change workflows due to a new software or tool. This can cause delays in your business and operations, but sometimes this is absolutely necessary. Tony Robbins, the management guru, said, when you have a strong enough why, you can bear almost any how. For example, if you're using ChatGPT now, but your prompts are not getting you the exact results you need when at one time they did, maybe it's time to switch. Or if you just don't believe that ChatGPT, parent company OpenAI, has patient safety in mind in the development of this tool, and you believe long term you need a safer alternative, perhaps like Claude, then perhaps it's time to make that change. Only you can make that decision on why you want to make that change now and deal with those switching costs. So one thing I want you to do before you decide is to clearly define your why before moving forward. When using Claude, you need to understand that Claude was built with trying to understand the inputs you give it before just blindly answering your questions. So sometimes when you ask Claude to do something, it may push back and ask you even more questions. Let me tell you why. Let's start with ChatGPT's default behavior. It tends to move toward being more agreeable, expansive, and warm. Ask it a question, you often get a thorough answer plus context you didn't request plus an offer to elaborate. Ask for 3 bullet points and you get an introduction, 3 bullets, a conclusion, and a follow-up question. OpenAI has worked hard to rein in these worst excesses of this pattern, but the general orientation to be helpful, to be thorough, to keep the conversation going remains the default. I've talked about this in previous videos. This is a feature, not a bug, because they built it to keep you engaged. So you use it more, if you use it more, you're going to see more valuable. And if it's more valuable, you're going to stay on the platform even longer and keep paying on that monthly fee. So this is what's happening for hundreds of millions of users, and this is what they think AI it really is. Claude, on the other hand, was built using an approach called constitutional AI, where the model is trained against explicit principles. For example, be helpful, be honest, avoid harm, rather than purely optimizing for what it feels like is a good response. The practical effect, Claude tends to flag a problem rather than smooth it over. It is more likely to ask what you're actually trying to do before it rushes to produce something that is plausible. Again, we talked about this on previous videos. These artificial intelligent models, these LLMs, are basically predictive algorithms. They're looking at patterns that they see from adjusting the entire internet. So they may give you an answer that's plausible, even probable, but it may not be the right answer for your context. So Claude was trained via constitutional AI to reason about whether a request is well framed before even answering, while ChatGPT was trained primarily with what we call RLHF, reinforcement learning from human feedback, to satisfy any quest as stated. RLHF is basically using humans to train the model on what a word actually means. So what's the problem with that? Well, what if the humans training the model don't truly understand what the word means or gives the model bad feedback? I can remember a time when I had a dog named Stringer, Maltese Poodle mix. He had a bad problem with peeing on our carpet in the house, and me and my wife just didn't know why. We had been teaching him to go pee outside, but often struggled to understand why Stringer kept peeing inside the house. But when we looked outside to where he always peed in his favorite spot, we found out something else was happening. There was an old patch of our carpet that was outside that he just kept returning to. So come to find out, we weren't actually reinforcing his behavior to pee outside. We were actually reinforcing his behavior to pee on carpet, regardless if it was inside or outside. Point being, influencing good behavior can still give a bad result if you're not careful. Again, influencing good behavior can still give you a bad result if you're not careful. So how can you use this? Well, take something you've already written, for instance, a draft or proposal, an email you're stuck on, and paste it in Claude with a sentence about what you're trying to accomplish and who the audience is. Claude's strength is taking your existing work and elevating it, finding weak arguments, tightening logic, improving clarity, and identifying what's missing. So give me a second. We're in 2026. AI is already in your practice with AI scribes, chatbots, automation, and tools buried inside your EMR. But do you actually know your risk? Independent practices and multi-specialty groups. One missed AI control can mean compliance exposure, bad documentation, or even silent billing errors. The new Healthcare AI Governance Scorecard gives you a single clear score on your AI safety, privacy, and automation maturity. You can see gaps before regulators, peers, or plaintiffs do. So in 2 minutes, you'll know where you're strong, where you're vulnerable, and what to fix next without even hiring a consultant. So if this is of interest, go ahead and click the link below and go ahead and download your copy. Get your score and protect your practice and patients. This is the time to budget for experimentation. Why is that super important? Because this time is moving so fast with AI implementations, and the organizations who execute today will have an advantage over those who do not. The future starts today, not tomorrow. Pope John Paul II. Here's how I'm playing with Claude to get more from it today. Maybe you can use this as an example. So for instance, I'm using it to create what we call a product requirements document, or PRD. And this is basically a way to kind of document how I'm thinking about what kind of new software tools or solutions I want to create for my customers. With this, I'm using it to do a fast prototype to show customers what it could look like. And I'm using tools like Figma to create new solutions for my customers. So now I have something to show them that's clickable and they get a sense of what it could look like. Previously, guess what I used to do? I had to spend hours on just researching what people may want, asking them, getting feedback, and then weeks to even schedule time on a call with them. Now I can create a new offer within minutes prior to any call. And guess what? My customers love that I constantly bring value to them with new offers, new opportunities on how to bring more value to their practice and to their patients. Likewise, you can take that example as well and use Claude to better your practice. Use it to understand different workflows. Use it to help understand your medical billing so you don't get as many denials. There's tons of things you can use with it, but you have to take that time to experiment and see what works best for you. The challenge with this tool is experimentation is so key because they can do so many different things, but context matters, like I talked about. And they're only as useful as much context you give it and what the problems you're trying to solve specifically to you, and then coming up with your own unique use cases. Yes, vendors can help, consultants can help, and if you need help, please reach out to us. But only when you kind of experiment and get a sense of what you're looking for, and you truly ask the right questions to vendors and consultants. So do the experimentation, try it for yourself. Take the time to play with the new LLMs and just see how it can improve some of the simple tasks you and your staff do every day. AI is growing everywhere now, right? You see in every type of industry, specifically in healthcare. We know AI voice agents are all the rage. This is one of the fastest growing slices of healthcare, where the global healthcare voice agent revenue is growing roughly at 35 to 38% year over year for the next decade. This is several times faster than overall healthcare IT. AI scribes, which gives doctors the ability to chart their patient interactions without having to do the tedious writing down, is on the rise. AI automation and medical billing is also growing. And then finally, new models, for instance, clinical diagnosis and predictive models, as well as digital twins, which are virtual replicas of real world people data that can sync together. This lets organizations monitor, stimulate, and optimize physical assets and really create a digital environment. Ultimately, the goal here with these digital twins is to create new drug discoveries. However, I am starting to hear stories about people in general rejecting anything AI related. One of the big things is AI psychosis, which is on the rise. This is an informal condition that appears to be triggered or worsened by heavy use of conversational AI tools, specifically chatbots. A typical person's delusions, paranoia, or loss of reality becomes centered around, amplified by interactions with these AI systems. For example, we've heard stories that AI is causing people to believe that AI is sentient, that it's divine, that's spying on them, or giving them secret missions. This is really driving some of the latest tragic cases with teenagers, and is really something we're fighting against now here as a society. Next, in healthcare specifically, privacy and surveillance worries are the dominant theme. There are studies that show that users with privacy cynicism have significantly more negative attitudes toward AI and other voice technologies and are less willing to share sensitive information. In fact, providers and patients raise concerns about where these AI data will be left, what happens in the case of a data breach, or uncertainty or where, how this data is stored and how it will be used, which can ultimately erode trust and slow adoption. I believe that a new trust barrier with AI will be needed and evolve over time as more and more patients and consumers push back on the tide of AI. For example, I believe that voice agents will start to identify themselves to patients as AI virtual agents, so people don't get confused that they're not talking to a real live human being. More and more companies will embrace this trust barrier, and I think that's the only way to kind of fight back against the tide of AI. So look for that prediction in 2026. If you don't remember, in 2024, Change Healthcare had a huge hack that was a ransomware attack by a black hat group that crippled U.S. claims and pharmacy transactions and exposed massive volumes of patient data. This forced United Healthcare Exchange Healthcare to pay an alleged ransom of about $22 million. And this ultimately prompted regulators to call it one of the most consequential healthcare cyber attacks in U.S. history. So think about this. Currently, we're seeing AI automation being a huge factor in medical billing. Makes sense. Medical billing is something you do consistently. Every month is pretty static once you have process in place. And the goal was always to get cheaper and cheaper resources, first here in the United States and overseas. Why not use AI automation? Matter of fact, most recent surveys suggest that roughly 65% of healthcare organizations now use some form of AI automation in revenue cycle and medical billing, with hospitals leading adoption and smaller practices catching up. Market reports also show the AI and medical billing segment growing from under $5 billion in the US today to upwards of tens of billions over the next decade. This is great, but unfortunately, you're exposing yourself to more and more risks. When something's automated, it's almost as if you set it and forget it. So if an incident happens, for instance, in AI, you can do something called prompt injection, where you can change the original viewpoint of the AI model to disrupt everything and sending medical billing off whack. That can disrupt things tremendously, especially if there's an automation that was created specifically for a certain type of claim. So I can absolutely see something like that happen in 2026. Be prepared for that and prepare yourself going forward. LLM stands for large language model. And those are the big companies like OpenAI, which produces ChatGPT, Gronk, owned by Elon Musk, Meta or Facebook, Google, and then Anthropic, which owns the Claude model. These large companies have built their own models, spent billions and billions of dollars and upwards probably trillions of dollars to build what they call these foundational models. But guess what? They need data to get better at their job. And one of the juiciest data sets out there is healthcare data. And so they're really trying to broker kind of relationships with healthcare models or healthcare organizations to know what's best to use. But I'm seeing more and more healthcare companies just being a little bit more cautious when partnering up with these foundational LLM companies and looking at their licensing agreements and being very careful. For example, I'm seeing healthcare organizations verify that the LLMs are not training their models with healthcare data specifically. If they partner with foundational model, these healthcare organizations are making sure that their data is not being used to train the model on their data set so that it shows up somewhere else when someone chats an ailment or something that was only specifically learned from Moffitt or from a large organization later. Moffitt Cancer Society or MD Anderson. This is something that's very careful. Also, that's security wise, PHI, patient health information, is huge, and you want to stay out of getting patient information out there. And so they really want to make sure in those licensing agreements between the foundational models and the healthcare organizations that they're airtight and protecting that data. Next, I'm seeing that healthcare organizations want to protect against hallucinations or drift from happening. So drift is basically moving away from the intended purpose of what that prompt, that chatbot was trying to get to when it came to that data set. They're looking at ways, making sure we protect that happening and what kind of governance can we put in place or in our model or in our licensing agreement. So if something happens, we'll do no harm to a patient. And last but not least, they want to guarantee there's always a human in the loop. This is a fancy term for making sure for any type of AI data gets released to the general public, it will be verified by a human. And so I think we're seeing more and more of that coming. So therefore, I predict that a lot of these large healthcare organizations will start to build their own LLMs using open source models so they can protect the IP and create their own specialized AI products. Recently, the government announced two big programs that really got healthcare excited. The first was the MAHA Elevate program. Make America Healthy Again is a new CMS test program that gives money to clinics and care teams to try whole person and lifestyle medicine help. For instance, they want to help patients with food choices, exercise plans, sleep, stress, and avoiding harmful substances while also making positive social connections. Each MAHA Elevate project can get an upwards of $3 million over 3 years and be a grant, and it will select groups like primary care practices and health centers to run the programs to support this healthy habits alongside regular medical care for people with Medicare and other insurers. Next, the access model, or the advancing chronic care with effective scalable solutions. So this is for people who have regular Medicare, who have problems like high blood pressure, diabetes, long-lasting pain or depression, and it encourages doctors and other providers to use things like providers, remote monitoring, and virtual care to help them every day, but not just at the office visits. The program will be voluntary and will last for 10 years starting July 2026. We'll pay provider groups in a way that rewards better health results and not just more services. So think of it as like a trial period to see if the outcomes match. You'll probably have an upside incentive program. And there are tons of models like that currently in healthcare that's doing that. The best way to kind of look at this is like the access model will be like giving doctors cool technology tools and paying them more when the patients with long-term illnesses do better. While Elevate is like paying teams to run healthy living hubs. So basically helping people to eat, move, sleep, and relax better so they don't get sick. Both of those models will be launching here next year, and it's super excited to see this excitement around some new models and some new care plans to help patients from a vendor standpoint. Open Evidence, which is a 3-year-old company and operates a ChatGPT-like product for doctors to find health information from medical journals and other trusted sources, is valued currently at $12 billion after it receives an investment of $250 million. So how does it win? And how does it justify that cost? Well, first of all, it has tens of thousands of medical professionals on the app, and its basic app is free. You can download it as a medical professional now. But they make their money by selling advertising space on this chatbot to pharmaceutical companies, similar to the way Google sells ads on the search engines. I absolutely believe that that's a proven model in healthcare and any type of model. Advertising is the way to go. So we'll probably see more investments in these areas where you can get more eyeballs. Can you sell advertising? Can you sell some type of services with access to such a valuable group like doctors? So more and more investments will coming in AI related type technology tool sets, just like Open Evidence. Let me give you my reasoning behind this and why I believe this will happen. Basically, people will not have access to quality care like they've used to in the time. And I tell you, 3 different things are happening at the same time next year. First, we see the Affordable Care Act. What happened recently is that the enhanced ACA premium subsidies are not being renewed and will lapse at the end of 2025. So the average out-of-pocket premiums for a subsidized marketplace enrollees are projected to more than double, to rising to about 110, 115% in 2026. And this is on top of any underlying base rate hikes that typically happen in insurance models. So the best estimate suggests that roughly 7 to 7.5 million people will leave ACA marketplace coverage in 2026. And if the enhanced premium tax credits expire and premiums spike, with about 4.5 to 5 million of them becoming uninsured and the rest shifting to other types of coverages like Medicaid or going off exchange. This is huge. This is almost close to 5 million people that will no longer have access to care that they used to getting. And these are folks that weren't working, traditional 9 to 5 where their employer provided care. So where are they going to go and how are they going to get the care that they need? This is going to be driving force in that crisis of access because they can't pay for healthcare. How would they get the healthcare that they need? The second big headwind, big insurers are starting to cut their Medicare Advantage plans. So Medicare Advantage plans are basically commercial plans, like run by United Healthcare, Humana, and others. They're basically their version of Medicare. What's happening now, the enrollment will dip by roughly 1 to 1.5 million people in 2026. Not because all those beneficiaries fully lose Medicare coverage, but because some will be forced to change or leave MA plans as insurers shrink or exit markets. So major carriers like United Healthcare, Humana, Aetna, CVS, Elevance, and others are collectively exiting hundreds of counties in 2026, with the Kaufman Family Foundation, or KFF, and other trade analysis documenting a roughly 10% drop in total MA plan offerings and notable pullbacks in rural and some urban counties. My company works with several payers, and we understand that they start to pull back in their Medicare Advantage plans because of this. It's just becoming too cost prohibitive to treat patients who have Medicare. And because it's costly to treat older patients who have chronic conditions or other ailments. And so the best way is cut that cost and get out of that market totally. So that's going to totally dry up a lot of individuals looking for access that they were typically getting from their Medicare Advantage plans. And then last but not least, under the new bill that was announced earlier this year and will be launching officially in January 1st, federal Medicaid funding will be reduced by roughly 15%. Which is about $1 trillion over the next 10 years. According to what the Congressional Budget Office is saying, That's going to be about 11 to 17 million people losing Medicaid and other public coverages over the next 10 years. This is huge. We're going to start slowly seeing that happen. So those three headwinds, Medicare Advantage, Medicaid, ACA subsidies, are going to just drive people not to get access to the care that they need. And so where are they going to go? And that's going to be a huge crisis in 2026. I like to start this out with a superpower discussion. What is that? Everyone has a superpower, even you listening to this video right now. But the top secret is you don't know what it is. A lot of times it's something you do so naturally and easily, it's hard for you to define exactly what you do. And it's so hard to understand it because it's not obvious like other type of talents like singing or dancing. You either know you can sing and you know you can dance. I don't have any of those capabilities, but I will say this, superpower is about understanding what's your unique talents you bring to the world, and that can change the world drastically. I like to hear what Albert Einstein said about this. Everyone is a genius, but if you judge a fish by its ability to climb a tree, it will live its whole life believing it is stupid. That's correct. I believe that wholeheartedly. I think everyone has the ability to be a genius at some area, but if they don't expose themselves to all the different areas, they may never find it and thinking they're stupid.
Patrick, go be stupid somewhere else.
But I can guarantee you, top of your head, many people you've seen them do amazing things, and to them it's simple. It doesn't make sense to how other people can't do it. I think you need to understand that and figure that out, and that's how you start being an innovator. Figure it out for yourself. So go around and asking your colleagues, the other individuals in the practice, the front desk, back office, what is your superpower? Is it the way you care for the patients? Is it the way you think about bringing innovative techniques and workflows into the medical practice? That's something that you think is simple and everyone can do it. That's your superpower. But more importantly, if you want to take it to the next level from an organization standpoint, ask your people what's their superpower and to start to document that. So now you have a bunch of individuals coming together, not just as Superman, but as a group of super-powered individuals tasked with winning and helping patients and helping change your organization for the better. Next, let's talk about the doing innovative things. Statistic from marketing consulting group BCG says that companies prioritizing innovation increases their chances of becoming market leaders by 60%. I can tell you a time when I built my company, my healthcare startup, SensorMed. I started out building version 0.0001, right? It was not the best, but I felt pride in what I built. But wasn't until I got with other individuals who thought more innovative things, like my business partner, who took that simple idea that was innovative and took it to the next level, adding new bells and whistles to it to make it super innovative. Not only was I built something that I thought was great, looked like something you could Google for it, right? But he added all these bells and whistles to allow it to connect to different devices and setting up API systems and all these fancy technical terms that made it super easy to use, but more importantly, very beautiful to look at. So because of his work and my efforts together from an innovative standpoint, we built something super fast and we got our first customer within the first 30 days. Amazing. This is something you can do today. I think you can be around other innovative people, and that's going to help you get to the next level, understanding by doing innovative things. Being in an environment will grow you into becoming the innovative person you want to become. Speed is an absolutely must in today's society. We're talking about it in previous videos about AI and technology moving fast, but you have to be aware and be cognizant of that. Dr. Regina Benjamin, who is a former US Surgeon General, said, "Patients can't wait for us to catch up. Innovation must happen today because lives depend on it." I want you to do this first step and send that email that you know you need to do. First steps are super important. So let's say there's an idea you have or a thought process you have. Go ahead and do that first step, whether that's send that email. Maybe you don't hit send. Maybe you could save it as a draft and save it for later. Maybe it's that person you need to call. Go ahead and put in your to-do list. Do that first step today. That's going to move you faster toward innovation and get you to where you need to be for the future. Currently, I think we're seeing AI being used across the country, and I want to give you about 5 different use cases and kind of what percentages each of them are at when it comes to delivering AI in healthcare around the country. First, we're seeing AI-assisted medical imaging, right? This has been around for a while, especially around radiologists, and this is really helping to interpret things like CT scans and MRIs for faster, more accurate diagnosis. It's been around for a while. So we're seeing a lot of healthcare organizations, especially hospitals with radiology departments, about 30% of them are already kind of doing this AI-assisted radiology look at. When we look at predictive analysis for patient risk, that's the other huge area. Right now, 25% of large healthcare systems are using predictive analytics in order to determine what's happening with their patient populations. And this has been around for a while, right? This is actually using, AI, but back then it was called machine learning and basically high-level statistics to understand which patients are going to need your help and be more predictive to determine if they're going to have adverse events and identify really those high-risk patients so you can prevent them from having even worse conditions later on. Those are kind of like ones that have been around for a while, but the newer ones that we're seeing starting to really take uptick and really grow aggressively is first, automated clinical documentation. This is also known as the better name of AI scribes. This is basically using natural language processing to automate medical note-taking during patient encounters. Roughly 17% of organizations are using it within the EMR so they don't have to manually type all that information in. And so it really saves a lot of time. The next one, we're seeing kind of workflow automation when it comes to streamlining competitive administrative tasks like claims management and appointment scheduling. We're seeing a lot of large and medium-sized medical organizations really looking at this, around 22% of the ones out there in the country. And last but not least, an area that near and dear to my heart, remote patient monitoring and alerts. And so what does this mean? This is using AI to collect and analyze data from basically monitoring patients at home, away from the clinic, and using these data from wearable devices, glucose monitors, continuous glucose monitors, blood pressure cuffs, and coming up with data to give early alerts to providers and healthcare clinicians. We're using it ourselves, reach out to patients and help them with compliance. Patient compliance is huge, and being able to monitor that is a great effort. 15% of all solutions out there are using some kind of AI tools, and that's the forefront. So as you can see, AI is pervasive already. But guess what? Not everybody is using it the same way. Look, before we begin, I want to make sure you're ready to think through what level you're at. So before we begin, kind of think through that and get prepared so you can understand where you are and assess yourself and get ready for the new normal, because this is coming faster than you think. So before I get into all that, these are the 5 levels that we're going to talk about. First, we're going to talk about level 1, which is you're not using it at all. And so you have current employees doing all the things, but you're not using it. And so we're going to talk about why and what that means. The second level would be understanding the use of AI scribes and some use cases inside the EHR. This is the base level where a lot of organizations are starting at, as we see now. The next level is now thinking about AI from an organizational standpoint and providing AI access to your employees, but more importantly, toward a common goal, not everybody doing their own thing. On level 4, we're looking at AI automations. This is basically workflows that are automated to do things that you already are doing, but now can be repetitive in the machines. And last but not least, you look at AI agents and then software with AI built in, and that's really the God level. This is where organizations are at and future organizations want to be at, where they're going. Once you kind of figure out what 5 levels you're at, then we're going to talk about, understanding what it takes to get to the next level. And then also, what the benefits and liabilities of that next level, so you understand what you're getting yourself into. My name is Theo Harvey. I'm a serial entrepreneur who went from lowly employee to CEO that runs a multi-million-dollar healthcare organization from his home. I raised over $1 million from VCs and investors, and I worked with larger organizations like Cisco Systems, AT&T, Blue Cross Blue Shield, and Google. My goal on these channels is really to help healthcare organizations prepare for the new normal in healthcare before it's too late. We're going to go into the 5 levels that I just discussed earlier. And the first level we're going to get into is not using it at all. You're a medical practice owner, you have all the staff from the front desk, back office staff, medical assistants to prepare the patients. You even have EMR and practice management software. You're kind of dealing with all the things, and this is great. Everything's fine and it's stable. But you know what? You probably think of artificial intelligence or AI as a fun little tool that you use personally from time to time. You may have open AI for free, but you're using it to do simple tasks like maybe check that spelling on that next email you send out, or asking the simple questions to kind of help you think through certain things, which is great. But you know what? The only way you really need to get to this next level is you really need to see the power of AI for yourself beyond the basic level. I'm going to tell you a story. For me, I used it just like everyone's played with it. Have my son up here and we kind of played with AI and looking at funny things it could do and repeat back to us. And that was great. But you know what? It is so much more powerful when you kind of think outside the box. And for me, that was really helping me understand how medical procedures work, understanding new medical literature, and really unpacking that with the help of AI, explaining the language I can understand, but more importantly, how can I implement it? And I think that's really what was the unlock for me, because it really opened my eyes to, hey, this tool is extremely powerful learning tool and really a thinking tool. It helps me think more clearly on what I can do better in my current day-to-day job. And that's went from a toy to a tool. Let me say that again. And from a toy to a tool. And I think that's what you need to realize when it comes to using AI and getting to the next level. If you want to try a simple prompt, next time you want to better understand the latest medical literature that you're reading, I say download the article and just ask OpenAI with the following prompt to help you select, understand, implement this new medical knowledge in your healthcare organization. Basically, the prompt goes something like this: act as a medical literature analyst, create a one-page brief on intervention for some kind of condition in this type of population, and base it on the most pivotal, highest quality study, and to produce a one-page clinic playbook to implement this intervention for condition immediately. Assume a general, setting such as a outpatient cardiologist or a hospitalist service. Bonus points for you: if you have a more advanced AI chatbot, you can have it pull it from PubMed, clinicaltrials.gov, or the FDA websites for drug information, so that it can automatically look that information up for you. Or you can actually use AI to help you write a prompt better, right? And do more with it. Like I said, the sky's the limit. And if you want to check out that prompt, put it in the notes below so you can just copy paste it, but try it and see if it works for you, if you're at that level 1 when it comes to using AI in your organization. Now, let's get to level 2. At this level, you play with AI scribes to help with documentation, right? You may even have some features in your HR to help you with triaging patients based on some kind of risk score. This is huge, right? So you're seeing the benefits of using it. And I think the best benefits you're seeing is starting to see how this tool can save you hours in time. I actually did a video on this where I detailed how much time you could waste with just documentation. Spoiler alert, it's roughly about 50 work hours. So if you want to check that out, go check out that video here and you can kind of look at it and see what I talked about there. But AI is actually doing the documentation for you, and that's helping you free up more time. So it is really helpful in doing that. And then I think a lot of organizations love that aspect of it. AI doing the documentation is great, but at this level, I think the goal should be to figure out how to give it more optimization out of the AI. So how do you tweak it to get better workflows, better processing of what you're trying to understand, especially if you're doing clinical notes, right? If you're doing charting, you want to make sure that charting is as accurate as it can be. And so in your current workflow, while avoiding AI response mistakes, because you want to understand if the AI is making mistakes, you want to correct that. Because if you didn't know, AI can absolutely go in different directions and give you responses that are wrong because it does something called hallucinate. It will make up answers if you're not careful. And so you want to make sure you have not just optimized workflows, but you also have some way to understand if that knowledge and that response is the most accurate it can be. For example, if you're recording all your clinical notes with an AI scribe manually, maybe figure out a way to have it do it automatically, and then incorporate a weekly check-in process to validate the correctness of the charting. Now, we really want to get into level 3. This is where you're thinking about chat AI access to all your employees. And not just chat AI access, but all AI, so that it's focused on a deliverable for the organization. So at this level, you have your employees that, guess what, if you didn't know, they're already using AI, top secret, but they aren't telling you. And I think that's the challenge when it comes to an organization usage of AI. We're seeing there is no sense of how to use it as an organization. And I think that's a big gap. I think there's a big gap between level 2 and level 3. But the key is, especially with healthcare, you have to be careful protecting PHI, or patient health information, because if your employees are using AI incorrectly, that information get out. And that is a violation of HIPAA laws. So the key is to kind of implement some kind of artificial intelligence standard operating procedure or SOP on how your employees will use AI in the organization that meets the standards from a regulation standpoint as well as from an organizational standpoint. So I can tell you, a story when we started, right? AI came out, we started to use it, play with it. I think people were having fun with it and doing fun things. I think for Christmas, one time I did a Christmas carol, and sent it out to everyone in the style of our business and our industry, and everybody had a kick out of that. But over time, as more and more people play with it, are using it to kind of create clinical workflows, things like that, which is fine. But the challenges started to pop up where actual patient information started to get in some of those workflows. That's a no-no. So we had to implement, with the help of our IT lead, standard procedures to make sure none of the information got out. And we more carefully set up parameters on making sure everyone followed certain strict guidelines for that. And then we also allowed them to use AI, but we also had our own standard version of it so everyone can use it and use it safely in our environment. So yes, you can have your own AI version that's on you, but you have your one that you can use based on our company workflow. And we have some things called custom GPTs that do certain projects for everybody, so everyone has access to. And I think you have to evolve to that point if you want to deliver AI at scale, because it's only when the employees are using it and everyone's aligned, then you're going to see the massive benefits that AI can bring to your organization, and not just to you as an individual. Next, we're going to get into level 4. This is where we're going to talk about AI automations. This is the beginning in helping you scale your healthcare or medical clinic profitable. What does that mean? With AI automation, you can start to put together powerful workflows that they task off your plate, not just your plate, but also your employees' plates. And it really makes getting things done a snap. So what does that mean? So there are tools like N8N and Maker. You can create an automatic workflow that you can take data from AI scribes and triage it inside of your EMR, so you know the priority on who you would need to reach out to, and do so automatically without ever having to lift a finger. These are workflows, are powerful workflows you can do. I think this is a great tool. The challenge is the upfront ability. This is something that you have to put upfront time into understanding the tools, and more importantly, you need to make sure they protect PHI again, patient health information. That time is worth it, right? But I can tell you right now, when we started doing AI automation, we kind of did it initially for our marketing efforts. So reaching out to potential doctors, potential partners, which is great because it's low level. If we messed up, we said the wrong thing, no harm, no foul. But the challenge was it kept messing up, and we had to tweak it, automate it. We had to figure out more things constantly. We got to 80% there, and I can tell you, within the first couple of days, 80% of it was done. The last 20%, tweaking it, getting the right words, not misspelling, not saying anything out of pocket, took us another 2 months to optimize it, right? We failed time and time again, so we can get better and better at tweaking it, which is fine. But once we kind of got it working, then it worked for us all the time. So the secret is here, when you think about this story, is that you have to be willing to continue to fail over and over again, because the ones who fail are the ones who win. Let me say that again. Those who are willing to continue to fail over and over are the ones who will win. It is imperative that you be willing to put that time up front if you want to be in this level 4. And last but not least, we have level 5, the God level, AI agents plus AI software. This is huge, the ultimate level. And I think about this as like AI agents that are specialized employees that can do everything you want them to do, from sending medical billing to patient outreach to claim processing to handle denials to doing prior authorizations. You can have an AI agent that does it all, which is amazing, right? You also have new AI software tools that can do some of the functionalities of running a medical practice, like medical billing and EMR. There are actually new tools, for instance, like Canvas Medical that does EMR, and Steady, which is a billing solution that were made with AI first in mind. So that means they have all the connection points in order to do this, and you can create all these great automations and kind of get things going on your own without a lot of headache, right? And this is going to be a powerful tool. One of the things that we're seeing is like large organizations are still really kind of delving deep into this, and they have the big IT departments to do so. So what they're doing is being able to protect their patient data from what they call foundational models. This is like the OpenAI, Meta, Google. They create their own kind of AI tools. They train their own models up with their own processes. And I talked about in a previous video as well on how ChatGPT and other kind of chatbots work when it comes to AI and how they learn it over time. And it's really more of a predictive algorithm to understand exactly what's likely for a human being to say in this given environment. So OpenAI, Meta, Google spend billions of dollars to build these foundational models, but I'm seeing large organizations kind of put filters around it so they can abstract information to help with certain things, but they're still protecting PHI, and that takes a lot of IT effort. Likewise, I'm also seeing customers start to create what they call model context protocols, or MCPs, which are basic connection points and instructions in order to kind of use AI to kind of do things automatically for you. So you can automate billing, so you can automate your claims processing, and it's all done for you just with your own MCP, and you can control that connection point. So for instance, access to your EMR, logging in, looking at information in there, right? That can be controlled with this MCP, and you can create your own agent without the use of, off the shelf agents, which is powerful. So these are great levels that you can get to. This level 5 is definitely seems a lot of upfront work. It is a lot of work, to be honest with you, to get to this level, but I do believe that it's worth it, especially for medical practices who are really want to get into this, because I can truly believe that this will transform the access, the affordability, right, and the effectiveness of medical clinics at the local level. Because imagine if one or two professionals, healthcare professionals, the doctor, the front desk person can manage thousands of patients. Imagine what that would mean for the cost, deliverability, as well as effectiveness of healthcare for certain regions, especially in rural healthcare. This is huge. So I really want to see more investment there and where it could go for the future with the right tool sets, because the sky's the limit for these type of organizations. Here's a simple action. Just pick what level are you at, right? And just be honest with yourself. I would say the majority of you are probably at 1 or 2, but some may start be getting into level 3. But in very few 4 and 5, we're starting to get into 4 and 5 ourselves. Where you are in your current workflow, and just mark it down. Go ahead and get a pen and paper, write it down. And then we'll talk about what that means next. Because number 2, you really need to understand what level you are so you can think about where you want to go next and what it would take to get there, and really think about the benefits and liabilities. Albert Einstein said, if I had an hour to solve a problem, I'll spend 55 minutes thinking about the problem and 5 minutes thinking about solutions. I think the key here is you have to understand your current employees. If you are not using that at all and you have current employees doing all the work, then you want to understand, the benefit, which is stability. This ain't going anywhere, right? You can do the same thing over and over again and have any issues. And I think that's so key. But the challenge there is it's going to be tough to grow, because you're going to have to put more inputs in, more time and effort, and that can lead to the liability, which is burnout. And also you're not innovating, which is going to be a problem, because more and more innovation is going to come into this space and you're going to be left behind. So it's definitely not an option for the majority of people. If you're listening to this video, I'm sure that's not an option for you. So we're just going to move on to the next one. I would say the next one is basically, we talked about, having some AI scribes and some EHR enhancements. The benefit there is free time. Documentation, we talked about that, can save, hours of time, which is great. It gives you open time and things that maybe you never done before you're using technology. The liabilities here is that the AI does and will make mistakes. So you need to have a person in the middle that can manage that process. And that can take a lot of time and effort to kind of sort through all that. And so you have to be prepared for that. The next level was like, giving AI access to your employees using AI from an organizational standpoint. The huge benefits there is scalability. You can scale your organization dramatically and do great things with that organization. And so because now you have AI tools that everyone has access to, and they can do great things and do more with not that much input. Challenge there is the people time. You have to spend a lot of front time with people to get them trained up, not on just the AI tools, but understanding what they need to do next, at least from an organizational standpoint, right? So they're all in line, and so everyone focused on the same outcomes. Next are AI automations. Benefit here is that you can scale, but it's lower cost. So it's the same kind of benefit of the people, but now you're doing that. Machines are doing the work. Machines are cheaper than people. And so you can scale with the AI automations. But the liabilities here, previously you had people time. This one is tech time. So much upfront effort to kind of deliver these tools. You can get there pretty quickly, 80% of the time or 80% of what you need. The last 20%, which is pretty much what you need to kind of make it work all the time, will take a lot more effort. And you need to prepare for that. And then last but not least, the God level is the AI agents with AI powered software, right? The benefit is here that you'll be the innovator. You're going to be the leader. People are going to look up to you. They're going to come miles away to kind of understand how you deliver this kind of clinician that's AI enabled with AI software, that's doing all the things, using people very little, but more importantly, you providing the best care for your patients, which is great. The challenge here is you have what they call pioneer costs. What is that? Well, think about the people that were on wagon train, the people that went to the gold rush in California. Any type of pioneer, there is a high cost. In those examples, those high costs were sometimes people lost lives due to disease, war, famine, things of that nature. The pioneer cost may not be that extreme when you're out there doing these technologies, but you may go down rabbit holes, paths that cost you lots and lots of money, right? If you don't know what you're doing, or you run into issues that no one else saw coming because you're paving a path. But again, to the ones who risk most, the rewards go the most to them. You have to risk more if you want more rewards. And if that's the path you want to go, then definitely I say start on that path and prepare for that for the future. AI is here. One of the big things that a lot of folks are talking about are what they call these ambient listening tools. What are those? Those are those tools that are listening in when you're talking to your patient and be able to code everything properly so you can bill for it, but more importantly, so you can look at your notes and review. Don't you think this AI is looking at this tool and looking at this data to determine how best you can provide clinical help? Yes, definitely look at these tools to kind of help you, augment you, and not replace you. Also, you have to learn new methods, right? They're doing things with their medical records, understanding about your patients and understanding what's happening with them, put them in different categories or buckets. Or we talked about this previously on this channel about stratification, right? Where you're looking at different ways you can look at the patient populations and treat them. So you want to understand how you can use technology to do predictive analytics to understand exactly how best to treat them. And so these tools can help you become a better practice, help you become a better professional, because they can enhance what you're already doing. This is a simple question I have to ask you. Are you using artificial intelligence in your practice? And if not, why? I think this is something that you have to do. I mean, every industry right now is being impacted by this. I have one simple thing you can do to get up to speed. It's very simple. You don't have to do much. We'll talk about it in a second, but let me give you some data first. A 2019 UK study suggested AI can replace up to 35% of jobs over the next 10 to 20 years. So that's why there's so much anxiety right now when it comes to this tool. We're hearing more and more folks embracing it and thinking it's better than anything. But there's problems with that. If as a domain expert, I guarantee you'll take this tool further than any person who's just going to Dr. Google to figure out what's wrong with them. And so this is something that you can take advantage of today. Bill Gates, big tech mogul, said that within the next decade, AI will make great medical advice almost universally acceptable. I think that's the case, right? We've seen the progression of this. Think about what happened before when it came to radiologists, right? There was teleradiology. Radiologists used to be in the hospital, right? Looking at the information and giving back the data of what the x-ray told them to the doctors. So they had the greatest information to help treat the patients. Then the technology with telehealth moved to teleradiology, where the radiologists were at home looking at the data, determine how best to treat the patients and calling in or sending in via the cloud. Now with artificial intelligence, it can now take this information from the x-ray and use artificial intelligence to do predictive analysis of what's happening with the patient based on thousands of cases of similar issues. And so I think this is something that we're going to see more of, right? Certain aspects that technology has impacted with care, some cases like outreach or clinical decision making can be outsourced to AI. So you have to learn these tools. Here's a fast way you can learn. This channel, this is what we're building it on, healthcare and AI. So we even did one specifically on AI and mental health, where we kind of walked why patients are looking at AI like ChatGPT to understand, talk to them as if it was a therapist. So go check out that video right here. Also, AI and talking about how it can be used to generate more revenue for you in your practice, understanding these new revenue models and how artificial intelligence can impact that. So go check out that video as well. These are some simple things you can do now to just get up to speed so you feel more comfortable, but also learn key instincts on what's happening out there so that you can be better prepared, just as if you would for any continuing education course. So go check those out, those resources, and let me know what you think about them. Tidal wave that's coming our way is regulation, specifically around Medicaid. Here in the United States, they just released the Big Beautiful Bill Act of 2025. And it has significant effect on federal taxes, credits, and deductions. And it was signed into law of July of 2025. So what's in it? Especially when it comes to Medicaid, significant cuts. So So if you don't know, Medicaid is basically insurance at the state level. It's really targeted for patients who may not have resources to get traditional healthcare insurance, and it's basically state run. So every state runs it differently and they kind of allocate it differently, but it's really being impacted with this new bill, especially as well as what they call the Children's Health Insurance Program, which is just for healthcare for children. So what's happening here? Well, first of all, in this bill, we're going to see cuts like Medicaid and CHIP coverage for individuals who cannot promptly verify citizenship or immigration status will be removed. We're going to see states going to have to implement work and community engagement requirements or work requirements for patients and adults who don't have dependents. They're going to be required to work in order to qualify for continual insurance coverages. And last but not least, have a reduction of retroactive coverage. So basically, they're going to limit how far back they go to cover you for some of your health concerns. This is huge. And so what does that mean? A recent data, if you look at all the Medicaid patients, right, that's on the program, 78 million patients across the United States alone. Recent data from the Kaufman Family Institute that this is a huge think tank. The estimate number of patients who will lose their Medicaid coverage is 7.8 million. That's roughly about 10% of the total Medicaid population. Question I want to ask you, how many patients do you have on Medicaid? And what if you lost 10% of that revenue to your practice? Let's do some simple math here. Average practice makes 15% margins when they deliver services to their patients. So what does that mean in practical numbers? For every $100 in revenue, you get back $15. Yeah, that's okay. It's not bad. Definitely could be more. And other industries have more, but that's decent. But with the loss of 10% in Medicaid revenue, you will only get to keep $5 for every $100 of Medicaid revenue you get. So that's a loss of about 67% of take-home money from Medicaid patients for you and your practice. What does that look like for you? How would that affect your organization and your practice for the future if you are having to lose this much in take-home pay, where over half, almost 2/3 of your revenue you were used to getting is gone now? This is a shame. Let's think back. I have a thought experiment for you. Think about last year. There was a recent clearinghouse organization called Change Healthcare, and they experienced a hack. Basically, clearinghouse is just a big warehouse, if you will, that takes all the claims, basically everything that was done for a patient, submits it into the clearinghouse. The clearinghouse cleans it up so it can be standardized in a certain format to send to the insurer, so the insurer can say, yes, this can get paid, and it sends it back out to the providers to get compensated for work they've already done. But Change Healthcare was one of the larger ones out there, and they got hacked by a group and basically said, hey, we're not going to release this information. You won't be get access to it. We have actually patient data unless you pay us a ransom in Bitcoin. It was very controversial. What ended up happening, Change Healthcare just shut down everything. They could not process any claims for months. So how many independent practices suffer from this? I can tell you for a fact, tens of thousands of practices. Some of them I worked with were struggling to make ends meet. They had to get loans and actually make payroll. Some of them just shut their doors. They just couldn't prepare for that drastic loss in revenue. This was huge, and a lot of them just suffered because they weren't prepared. Not preparing for revenue loss in your practice means you were preparing to close your practice. So let me say that again. Not preparing for revenue loss in your business means you're preparing to close your business. This is just a fact. Warren Buffett, big time investor from Berkshire Hathaway, said, revenue is vanity, profit is sandy, and cash is king. You have to find new ways to bring in revenue for your practice when you're going to see drastic revenue changes. We'll talk about that next on how you can do that. So here's one action item for this section. You have to make up your mind today to do something about the coming revenue. I'll be honest with you. If you're not going to do anything, you might as well just turn off this video and move on. I'm really trying to give you some insight. As you can tell, I'm super passionate about this because I talk to practices all day, every day, and I see the pain they're in from staffing, revenue loss, new regulations, new technology. Don't be one of them. Think of ways you can grow your practice now so you don't be underwater when it comes to you. Build your boat now before the tidal wave comes. You have to invest in your skills and knowledge. Yes, you take continuing education units, CEUs every year to understand the latest medical information, but you have to understand the business of technology, business of growing revenue, so that you don't be left behind. This is some ways you can do it. I just talked about that one big beautiful bill, right? How it's going to decimate Medicaid. But in crisis, there's opportunity. Again, in crisis, there is opportunity. And in that bill, they also released what they call direct primary care opportunities. If you don't know, direct primary care or concierge medicine is a way for patients to pay into a medical membership service once a month and getting direct access to physicians, speedier responses, labs, things like that. This is a huge growth area. So for the first time ever, patients who have what they call high deductible health plans, so basically these are health plans that you have to meet a certain number, typically thousands of dollars before the health insurance kicks in. They're going to allow you to use your HSA, your health spending account, in order to pay into these membership plans, $150 a month or $300 a month if you're a family. This is a huge opportunity because now this is tax deductible money that can be used and has never been done before. And so if you are a primary care physician or healthcare provider, this is a perfect time to get in there now and offer your services to employer group, right? Because now they have incentive deductions, tax deductions to provide this type of service. And this is huge revenue opportunity. So again, bill decimated one area, but another area you have opportunity. There's other opportunities, right? Artificial intelligence, we just talked about that, but how can you use it in your practice today? Help your employees become more efficient using AI so that you don't have to hire more staff and you can cut your costs. Look at it to provide those ambient listening tools, right? So you can have it understand what you're saying, code for you automatically, but also have your notes there so you can reread them, understand exactly how to treat that patient. But there's also new service lines. I'm seeing practices get into clinical trials to grow revenue that way, or offering cosmetic services like Botox in order to kind of drive revenue. Think outside the box and you'll see there's new revenue opportunities all around. We talk about this all the time on this channel, but remote care as a service programs like RPM, CCM, those are opportunities to grow revenue. And guess what? This is a recurring revenue model. So that means it's consistent relatively over month as long as the patients stay on the programs. So these are huge opportunities for you to build your boat before that tidal wave comes and ride the wave and not be taken under by it. So definitely do that. Jeff Bezos, huge entrepreneur, Amazon, said humans tend to overestimate risk and underestimate opportunity. Albert Einstein said, imagination is everything, is a preview of life's coming attractions. So let's talk through an important workflow that most practices deal with every day: getting new patients scheduled and preparing them for the visit. Medical practices typically lose significant revenue each year due to patient no-shows. The most recent statistic shows that independent physician practices in the U.S. face an estimated annual loss of approximately $150,000 from missed appointments, with each no-show costing the medical practice an average of $200 per appointment slot. Let's say a patient calls to schedule a new patient visit. The voice agent, AI agent in this case, will verify their identity and insurance. Next, this new agent that we'll talk about today will capture the reason for a visit. For example, it could be a new high blood pressure patient who's experiencing their home blood pressure readings are above 140, something around 160 over 100. This is a big deal. Once it gets that information, the AI agent can then book a 30-minute new patient slot. Then it can automatically text intake and parking info to the patient. That's so frustrating. And if you've ever been a patient trying to get parking at some of these clinics or medical practices, they will love you for that. Simple fact. Finally, if there are red flags, for example, chest pains or neurological deficits, it can provide a warm handoff to start immediately reaching out to staff and label the call urgent triage. What if prior to the appointment, you can also have insurance re-verify before the visit? Between 3 to 5 days before the appointment, the AI agent can absolutely ping a text via or even send a phone call. It can ask the patient to confirm their insurance plan details. If coverage changes, it collects updated info, offers cash pay options per clinic policy. It can even have the patient deal with no-shows for their appointments. This AI agent can absolutely text the patient a one-click reschedule link. That's super important. It can then offer that freed up slot to a waitlisted patient in priority order. Finally, the patient does show up, and now you can create a patient collections follow-up process. After the visit, the AI agent that you will create reaches out to the patients with outstanding balances. It can confirm preferred payment methods, offers to pay securely via links on a phone, and answer common billing questions. These workflows are numerous, right? And this simple workflow can truly transform your practice. Think of all the time and lost revenue that you're losing with not implementing some of these simple workflows. Other workflows could be now tied to quality measures that you get incentive reimbursements for instance, like flu shot outreach or retina detachment risk detection or colorectal outreach. These are all things that you can start to look at to implement and why it's so important. In October 2020, the VA launched a massive EHR modernization program. The goal was to move it to a new EHR under Cerner. So they started with their VA Medical Center in Spokane, Washington. So they rushed ahead with the implementation. However, oversight reports and investigative stories have documented that system performance issues and outages began to show up. There were slowing clinical workflows that were not being implemented. There were misidentified patient information, including notes and test results. This is a huge issue. Medication ordering problems. And this is really partly due to like this new complex workflow and interfaces. So the VA ultimately had to pause implementation to better prepare the infrastructure. Look, the point of the story is proper preparation prevents poor performance. Let me say that again. You may have missed a middle P in there. Proper preparation prevents poor performance. The overwhelm can get to you hard, especially when you start a new project and really when you get in these workflows. So I think I have a simple hack that most medical practices that we work with like, and I will talk about a little bit more below. So to prepare to get started in your infrastructure, you have to document simple current workflows. So we're going to take an example of like patient scheduling. I would recommend that you write down patient scheduling journey from the first call with the front desk to arriving to the clinic to getting a call from your back office medical billing team. Think about that. That's that patient journey all the way through. Really understand that. Next, you need to understand the current capabilities of your EMR and make sure it's future-proof with upcoming AI voice agents and AI automation. I know it's a lot to overwhelm, but just understand the basics. Can it make simple call requests? Can it route those calls to someone? Understand that and what the capabilities are. Then finally, you need to start thinking about a dashboard to track the results as you start to go down this journey so that you can see metrics like reclaimed hours and fill rate. So look, you need to make sure that this journey is going to be worth the path. The money you're going to invest up front, will you get that and even more on the back end? And that's what the dashboards help with. Here's a secret hack I've been hinting at. Hire a virtual assistant to start this documentation process. We have seen this is really effective because you can hire this inexpensive resource that can do this without taking any time away from your team. And as we know, your staff, they have so many things to do. Another project is going to overwhelm them. And more importantly, this virtual assistant will bring a fresh perspective as documentation is being complete. They can answer questions and be real basic. Bring that beginner mindset to it so they can understand and give you new insight into how these practices, workflows are really working. This info, you would then understand how to actually implement these new patient AI workflows for the maximum impact. According to the American Hospital Association, around 30% of surveyed consumers said they selected a new doctor in a recent year, up from roughly 26% a few years earlier. A National Hospital Health System survey found that about 1 in 5 consumers switched doctors in the past year, with nearly 90% saying they left because the organization was hard to deal with. Patients want organizations that are responsive to their needs and easy to work with. I'd like to tell you a story about Dr. Terreri, a doctor out of Middle Georgia that absolutely took advantage of this, right? He had the opportunity to build in a better way to reach out to his patients using remote patient monitoring to kind of communicate to them more effectively in a rural area. So imagine that. So he was pulmonologist competing with other pulmonologists in the area, but he offered one convenient outlet, ability to provide them with a pulse ox device so that he can understand what was going on with their COPD and track. That one little thing enabled him to onboard thousands of new patients in the span of a year. This is huge. I mean, those that do now won't have to pay later. Let me say that again. Those who do now won't have to pay later. Here's a simple action. Don't implement these strategies and then see what happens to your patient volume. Understanding and unpacking the different areas of what it means to understand AI more effectively, right? And how you're using it today, and more importantly, how you can incorporate in your current workflows, right? And I absolutely believe these 4 areas will help you frame how to think about using artificial intelligence in your leadership every day. Everyone understands that artificial intelligence helps with organizing data into something that can be very useful. But why is it that so important for leaders? Great leaders need great data in order to effectively lead. And the best data is information that gives signals if your actions are moving in the right direction. This type of data is called benchmarks, and it can change how you lead. Jeffrey Moore, management consultant author who wrote Crossing the Chasm, which explores the challenges startups face transitioning from early adopters to mainstream customers. Without big data, you are blind and deaf in the middle of a freeway. So let me tell you a little bit about Napoleon. Everyone understands the General Napoleon who took over Europe from France in the 1800s, right? But he was known for his speed with his armies, positioning well, and using his resources, his infantry, his artillery, to the most maximum effect. This led to him winning 90% of all his battles. So how did he do it? He created the largest map department in all of Europe. They gathered and cleaned thousands of maps, land surveys, and topographic memoirs to get a complete picture of every territory in Europe. He understood Europe better than most people in the country. The point is, insightful leaders gather insights from the best data. Let me say that again. Insightful leaders gather insights from the best data. AI can do research faster than ever, and more importantly, it can lead you to the correct sources for benchmark performances. So here's a simple action. As a medical practice owner or healthcare organization leader, use AI to get benchmarks on patient engagement and patient satisfaction. If you start to understand where your organization is in comparison to others, I guarantee that's a path that you can go down to be more successful. I like to think of Jim Collins, who wrote the great book, Good to Great. Great companies keep track of what works, not just to celebrate, but to replicate. Standard operating procedures, or SOPs, are like recipes for success. Doing the right thing allows you to uncover what is working and to make it easy to share these success nuggets with your team. Look, at the end, I will point you to additional resources to help. According to studies, documenting engaging stories, such as patient success videos or testimonials, can increase healthcare employee engagement by up to 20% because it boosts community trust and help attract new patients. One of the things I want you to do is, if you want to learn more about how to implement standard operating procedures or SOPs in your organization, I did a whole nother video that you can watch here, and that talks about how to use SOPs to engage your team no matter where they live in the world. I know your secret, and it's okay because I do it too. Guess what? We all do it. We are all using AI to rewrite our emails and the messages we send to colleagues and our employees. Why is that? Because we want to appear smarter. You don't want to have issues with spelling or grammar mistakes, and you won't be clear in your messaging. So of course you use AI. Like many of you, I didn't want everyone to know that I was using AI. But I will show you a trick when you can switch from a sense of embarrassment to one of pride about using AI. Oprah Winfrey once said, "Turn your wounds into wisdom." I can tell you about myself. I'm a terrible speller. For some reason, in elementary school, I never slowed down enough to learn all the tricks. For instance, I before E except after C. You know all the things. As a leader of a growing company, I was embarrassed when I sent things of misspellings. I had to rewrite them, the grammar is incorrect, and I spent hours writing simple emails. And I initially resisted tools, but after a particular embarrassment with a customer interaction where we lost a deal and some bad grammar, I started to change. And with the tools like autocorrect and Grammarly, ChatGPT, I was able to finally be free and encourage others to give it a try after it so much helped me. I became an advocate, right? As opposed to someone who was in the closet. The point I'm trying to make is your mess can be your message. These are the next generation of the AI bot army I talked about earlier. These are going to be automations that you can build out that can do processes over and over again consistently. For instance, we're using it now to do outreach to potential customers, and it runs all the time. But the issue is, can AI do that? That is a question you have to fundamentally understand and be curious about as you look to ways to use AI. We have been brought up to believe that AI is either a glorified autocorrect or AI can cure cancer. But I believe the truth really lies somewhere in between. And the only way to really know for yourself is to play with it, make it do tasks for you. Google famously has a 20% time policy, which allows employees to spend 20% of their working hours on projects outside of their core job responsibilities. This allowed employees to dive into projects that drove passion. The results of this play speak for themselves. From 2004 to 2010, when the policy was widespread, Google grew their revenue from $3 billion to $29 billion. Their market capitalization, or example, the value of their stock over that period of time, went from $23 billion to $190 billion. The point is, organizations who experiment experience explosive growth. Organizations who experiment experience explosive growth. Start playing with AI automation today, and I guarantee you're going to have success on understanding how better use these tools in your day-to-day leadership goals. Is this something you have to go step by step? I don't believe you have to. As a leader, you now have 4 levels of different ways of using AI with your people. You have from research to SOPs to being a teacher of the tools that you use personally to being an experimenter. So is it possible to do all the layers and levels at once? Indra Nooyi, former CEO of PepsiCo, said leadership is about learning to balance multiple priorities while losing sight of what's essential. Yes, you can, but you need to have a clear path and vision of what you're looking to accomplish with this tool as a leader. Just as your leadership role is multifaceted, and if you focus on working with multiple people, so is your ability to use tools to meet the needs of the same people. Let's talk about a hammer, right? Typically used to hammer in nails, but guess what? There can be tons of different uses. It can reseal paint cans, assemble flat back furniture. It can install wall anchors. It can nudge a stuck door or window frame, crack ice, or break large salt dumps. It can sound out hollow spots in a wall or frame. It can close pop top lids and metal tins. The list goes on and on. Likewise, you have the opportunity to use the tools you see fit, but you will need to know when and how to use them. An AI tool is only useful as its user. Let me say that again. Any tool is only as useful as its user. Leadership is timeless, but the tools are constantly changing. The leaders who adapt will be more effective and therefore more likely to get the best results of their people. Research from BCG and Columbia Business School says that employees and organizations with adaptive leaders, those who model and support tech adoption, are 70% more likely to feel enthusiastic about adopting new tools and 92% more likely to feel well-informed about technology changes, which accelerates organization-wide transformation. Leaders who don't change with the new tools will become irrelevant. Becoming the leader you need to be for your organization is the only way you can be successful and not be left behind. So hopefully I kind of walk you through all the different areas to think about leadership when it comes to AI in this new age. Are you aware that healthcare diagnosis has a unique feature that makes it difficult for AI systems to master? Ray Dalio, founder of Bridgewater Associates, he said, "He who lives by the crystal ball will eat shattered glass. Hedge your bets because the future is never certain." Unlike coding or mathematics, medicine rarely deals in absolutes. Clinical documentation is filled with hedge language. Phrases like cannot rule out, may represent, or follow-up recommended or correlation. These aren't careless ambiguities, they're defensible signals shaped by decades of legal precedent and diagnostic uncertainty. Again, like we talked about previously, this goes back to malpractice and doing no harm. In medicine, false positives and negatives show up all the time, and it's up to top doctors and clinicians to interpret this into info to the best of their ability. In context, a false positive means the test result is positive, but the person does not actually have the disease. An example would be a pregnancy test that shows positive when the person is unfortunately not pregnant. A false negative means that the test result is negative, but the person actually has the disease. A blood test for diabetes failing to detect high sugar in a person who does in fact have diabetes is so key. But let's look at the data around false positives, right? And some of the common tests that are happening. For instance, breast cancer screening. In the US, the false positive rate can be as high as 15% over a 10-year period. Half of women screened will receive a false positive. This means 90 to 95% of women who get a positive mammogram do not, in fact, have cancer. So doctors really have to interpret the language in context based on an experience, while AI It has to learn from patterns in the text. That's the distinguishing factor of what it means to be a doctor versus the AI systems. So therefore, the hedge language is ubiquitous in a lot of clinical diagnoses, and AI models built on this data set may overpredict, which can degrade specificity and clinical utility. So without careful, curated labels and a deeper understanding of the intent behind the language, AI systems will inherit human caution, but not human judgment. Let me say that again. If we're not careful, AI systems will inherit human caution, but not human judgment. One of the big issues that are starting to emerge is the cause of AI, where it makes a decision on patient care, and you have to think about if it's wrong, who is liable? For example, if a radiologist misreads a scan, the patient or family can seek legal recourse. Doctors carry insurance. They can be sanctioned. They can lose their license. But what happens when an AI model makes an error? Is the hospital liable for deploying the model? Is the radiologist liable for trusting the output? Is the startup that built the model accountable? And if no individual can be blamed, can anyone be held responsible? This quote from John F. Kennedy sums this up nicely. Victory has 100 fathers, but defeat is an orphan. So unfortunately, medicine is filled with stories like this. For example, in 1984, 18-year-old Libby Zion died in a New York hospital after being given a combination of medications that interacted fatally. The residents who treated her were overworked, supervising physicians were absent, and hospital communication just broke down. No single person took responsibility. The residents blamed the system, the hospital blamed the fatigue, and regulators blamed poor oversight. Zion's parents fought for accountability, leading to the Libby Zion law, which limited residents' working hours. The point here is that when there is no human accountability, humans suffer. Again, when there is no human accountability, humans will suffer. It unfortunately took a tragedy to force systemic reform because no one initially accepted personal responsibility for her death. Ultimately, AI is here and it can be extremely useful. In fact, I talked about this multiple times on this channel alone of use cases. But like all tools, humans need to use them with care. For example, as AI becomes more embedded in clinical workflows, and they start to understand what's going on with them and how they can be used, administrators and other hospital staff need to really understand clear liability frameworks with their use. When you work with AI vendors, think about false positives and false negatives and understand the continuum, how you're using them and how AI is picturing that. Let's say an example from radiology. In the case of a false negative, if a radiologist ignores the AI interpretation in favor of their own best judgment and it's a false negative, then is it the radiologist liable for ignoring the AI suggestion? Or if it's a false positive, if a radiologist ignores AI interpretation in favor of their own best judgment and is a false positive, then should a radiologist get credit for ignoring this AI suggestion? Again, ignoring or liable for going with their best judgment. How does that work? And you really need to unpack that. Having these deep discussions with your healthcare administrators and your vendor selection committee so you can have a clear path on how to protect the patients is going to be so vital. Again, it goes back to do no harm. AI is great, but I definitely think there are caveats. We're going to talk about some of the key points of how to use it shortly, but let's talk about like some of the benefits and how to think through it. There's a quote by President Ronald Reagan, "Trust but verify." That's correct. AI is great. Look, it is fairly accurate according to the Journal of Medical Internet Research in 2023. Recent case studies, they were able to find several things. First, that with 72% overall accuracy was great. 77% for final diagnosis was accurate and great. 68% for clinical management and 60% for differential diagnosis, basically determine what is the difference between this presenting symptom and something else and what it could be the underlying cause of it was great. These are all great opportunities, but I think just because something is 60% effective, there's still about 40% of it not being effective, and that's wide margin. I'd like to tell a story I read from Robin Berzine, who runs the RBMD Off Script email, and she wrote about one of her longtime patients, who showed up to a Zoom visit with a full AI generated treatment plan. That's right, the patient came prepared. The patient had uploaded their labs and health goals and used ChatGPT for alternative statins. So basically, they used that for heart conditions. The patient got exactly what they asked for: 2 second-line drugs, plus plan for nutrition, supplements, exercise, much of which they were already doing together. On paper, the answer was technically correct, but it missed some key points, according to Robin. She mentioned that it didn't address that he was resistant to statins in the first place, or which alternative might actually move the needle on his cholesterol based on his history and inflammation markers and family risk. Look, just because ChatGPT gives you an answer, it doesn't mean it's the correct one, and it doesn't know your full history. So definitely encourage your patients, move toward the innovation, but you definitely want to guide them to better success. So I'd like to say that again. You gotta encourage your patients toward innovation, like using AI, but you need to be a guide so they understand all the parameters and context so they can be successful and not move into harm, especially when it comes to healthcare. I'd like to give you some high-level guidelines, when you're advising your patients on using AI or ChatGPT type functions. First, inputs absolutely matter. Definitely without medical training, there's a lot of key details that can be missed when it comes to patient populations. Just like that story, you need to understand family history, subtle lab markers, allergies, medications. There's a lot of things that can be missed in context because you're putting together care plans that are surface level. Having someone that understands that at a deeper level, like your doctor, is so important. So that's something that you can educate your patients on. The inputs matter. They can't just go to ChatGPT and put in random information. Secondly, hallucinations do happen. So we talked about this on this channel before. ChatGPT and other large language models, or LLMs, occasionally what they call hallucinate. They create fake studies, citations, treatment protocols. I've done this on this channel before, but actually go in there, and if it creates something that doesn't make sense, ask ChatGPT, evaluate what it just said. And a lot of times you'll find out it says, oh, that information is inaccurate, or I may have exaggerated something. ChatGPT is built with neural pathways like human beings, so it can come up with connections that may not make sense on the surface. Also, it's something that it can't really explain until you really have it think about what it thought about. So I'll say that again. You help ChatGPT think about what it's responding to so that it can answer correctly. You don't want to hallucinate and make up things, especially when it comes to your patient's health. Third, context is everything. Even great answers can be wrong if they don't apply to your body, history, lifestyle, etc. AI just can't understand the underlying issues and recognize all that's going on with you. Medicine itself can't recognize that human beings are unique and different. It's not just your genes, but your environment, how you live. A lot of factors go into that, right? Having another human being kind of understand that context, because they are a human being, can give pause to certain things that may be more experimental, may not be needed. And so that's super important. Nuance still needs humans. Let me say that again. Nuance still needs humans. Next, privacy is so important, especially when it comes to healthcare. And when you deal with these off-the-shelf large language models built by OpenAI, Google, Facebook, that data is open now, right, to a business. And so that means your protected health information, or PHI, has to be protected. And so that's so key, because you put in information into this computer and it spits out something fairly reasonable, doesn't mean your information is not going to get out there. So be careful and make sure your patients are aware that whatever they put in there can get exposed and come back later for them. And then last but not least, just because something is fast doesn't mean it's effective. Let me say that again. Just because something is fast does not mean it's an expert. AI is quick on responding. If you ever try to put ChatGPT and looking for an answer, it gives you that surety. We talked about on this channel before about AI hallucinations or AI delusions, where human beings go into the ChatGPT and come out with delusions of grandeur because ChatGPT is responding quickly and also affirming them, right? Giving them positive responses. So they just get deeper and deeper into psychosis. And so it's super important to realize that just because it's saying something quick doesn't mean it's an expert at it. You need to understand that, just because a symptom combo means watch and wait or go to the ER now, you just don't know what that means exactly for your space, right? And so you have to be careful, and having a human being walk patients through that is so important. That's kind of like the high level. But let's talk about some of the do's, for AI. You can absolutely use it to understand lab results better. For instance, I know my business partner, he's actually used it to kind of understand some of his heart lab results and understand what they mean and help you decode all these different numbers and flags and what they should or should not be, what the baselines are. And that helps them. Really helps to kind of just understand like things like that. It can help you triage sudden symptoms, right? Wondering if that chest rash needs urgent care, or if your toddler's fever, can it wait till Wednesday? You just don't know. So just getting a sense of like how severe on the scale of this issue also can help you prep for appointments. So you have a doctor appointment, right? There's a lot of stuff. We talked about the context that's needed in making a better physician diagnoses, right? So making sure the patients understand that they can put understanding of lists, the symptoms clearly, prepare smart questions they can ask you so that when they're confronted with the patient, then they can ask correct questions and you can give powerful answers that they can apply today. It can also help your patients organize supplement routine, right? There's a lot of supplements. Obviously, we're in the wellness world, and so people are taking tons of supplements. So, really kind of parsing that out so they can have a great routine and how to deliver that. And then also solve random low-level issues, right? Say you hurt your nail, help to kind of figure out how your kid may have got stuck with glue to a doorknob or something to that effect. ChatGPT can help you navigate that process and get them out some home remedies that you may not have found readily with Google. But I have a bonus for you as a medical professional. I think there is a tool that you can use. We talked on this channel, of course, about AI scribes that allow you to record charting as you're reading out loud so that you don't have to chart manually, and AI is kind of recording in the background. There's a powerful new tool called Open Evidence. Open Evidence is a free app that you can download with a ChatGPT-like interface, but they have guardrails and cite responses to the New England Journal of Medicine, JAMA, and other reputable medical journals. So now it's kind of like a reference guide that you can pull up at a drop of a hat. And this is going gangbusters. About half the doctors in the US alone are using Open Evidence to help them navigate the process of how to deal with new symptoms, and also seeing what new journals are out there that can help their patients. Again, AI is powerful. You just have to know how to use it, not just for your patients, but also for yourself in delivering better care to your patients. The don'ts, you don't want to diagnose complex health conditions. You don't prescribe meds or supplements. So if the patients come and say, ChatGPT told me to buy this supplement, you say, hold up, let's discuss that. You don't want to have source natural remedies, say, hey, instead of taking this medication that's off the shelf, that's reputable, that has studies around it, no, you need to drink this tea. There's been stories of people who drink dandelion tea that stop a UTI. Also, you want to just not use it for being a therapist. So your patients may be using it to say, well, ChatGPT said have family issues and dad issues that go back all these years. That's great. But look, they're not human. Yes, they have some understanding of some basic knowledge from a psychology standpoint, but really understand the nuance of what that is, your family history, having, data. And ChatGPT is also not giving other signals, right? You're just typing information into a box. A human being who's a therapist is actually looking at the patient, understanding, how did their pace quicken, temperature rise a little bit? Did they sit up a little bit when they talked about their dad? Did they slump back a little bit? Talked about their mom, looking at body motion, looking at inflections when they speak and communicate. Those are all powerful things that can kind of indicate what's going on with the patient beyond just words, right? And so that's super important. You need to have a physical therapist that can listen, hear, and has a human response. And also, if you're uploading health information in the ChatGPT, that's just a no-no. Quote from Steve Jobs said, technology is nothing. What's important is that you have faith in people. Have faith in people, and that's what you educate your patients on. So guide your patients in the use of these tools more correctly, and I guarantee they will trust you. The story of geese who migrate. They fly in a V formation that allows each bird to take advantage of their air currents created by the one in front. This teamwork actually helps them speed up. The formation reduces resistance, allowing the flock to fly 71% farther than in each bird flew alone. The leadership lesson here is that when the lead goose tires, another takes its place. Everyone shares the effort so the group can keep moving forward efficiently. The point of the story is working together will multiply speed and endurance in the face of headwinds. Again, working together will multiply speed and endurance in the face of headwinds. Having a group of like-minded individuals to help you move fast through this process of learning these technologies, best practices come up, pitfalls to avoid. You're learning so much, and it's because it's in a group setting, you're getting more information faster, and it becomes more like a hive mind. AI is great, but using it out of the box is not wise in healthcare. Why is that? There are multiple things that can go wrong with it. One is a process called hallucination. This is where the artificial intelligence just makes up things, right? Just makes up steps, makes up ideas. And a lot of times you have to understand how it can get through that process without messing up. And healthcare is so important that you have to be clear, because if you're not clear and getting a process started or any type of operations, people could get hurt seriously. Here's a fun fact. You can see this in action next time you do a prompt on ChatGPT. After you get your answer, put in this exact phrase: "Can you please check your answer?" I can tell you right now, you will be amazed about what it comes back with. I've done that multiple times before. So check that out. Let me know if that works for you. This is a quote by Sam Altman, CEO of OpenAI. He said, "The thing that I try to caution people the most is what we call the hallucinations problem. Model will confidently state things as if they were facts that are entirely made up." So you want to be careful about that. So I would recommend not using artificial intelligence or AI for use for clinical decision making or diagnoses. But we do want to utilize it to encourage patients to take their medications, remember their appointments, or general engagement with doctor instruction. It tends to work great that way. Matter of fact, there was a study, a 2024 study in the journal Healthcare, that tested an AI-driven appointment scheduling system, which predicts no shows and automatically reallocates resources to open slots. Implementing the AI system raised the proportion of patients who actually attended their scheduled appointments by 10 percentage points per month and boosted clinic capacity utilization by 6 points. You can change behavior with personalized AI messaging, in our opinion, based on the studies, but also on what we've thought about using AI. So that's kind of what we thought about. We weren't looking at artificial intelligence to change diagnoses or to help with patient awareness. Really, it was about getting patients to change their behavior so they can make appointments, get their medications done, things like that, because that's the key. We think is really changing behavior, because healthcare is really self-managed a lot of times, right? Patients just don't listen to what the doctor says to do those preventative things that we all know that they need to do. That's kind of how we thought about it first, right? I can remember a time when we struggled to get patients to use their blood pressure devices, right, with our solution. We saw what was happening was that they would kind of get lost and not use it, and then after time they would just drop out of our remote blood pressure monitoring program. This is key, right? They had to stay on that program in order for the practices to understand how to best help the patients. If they were chronic kidney disease patients, you can slow down the progression of CKD with patients who are taking their blood pressure, understanding what's going on with their blood pressure over time by having controlled hypertensive or understanding what's going on with their blood pressure. Patients can slow the progression of this disease state, chronic kidney disease. And so what was happening was these patients weren't doing it, right? We were struggling with it over and over again. It wasn't until we kind of thought about like, how can we kind of engage them, right, to do it more. And so we did some simple tweaks. What was the best time for the patients to take the blood pressure readings? What are areas that encourage them to want to take it? Let's say they have a wedding for their daughter or son that they want to attend and not be sick and not feeling worse. What are some goals that they have for their lives? Just really understanding, what was motivating them, the why, when they were taking the blood pressure reading, how were they taking it? Were they taking it standing up? Where they just had a sugary meal. So once we kind of understand the who, what, why, where, when, then we're able to kind of use artificial intelligence to make it personalized, right? To understand exactly when's the best time to remind them to take a reading, right? Based on what they were doing already. Reminders of the why they were going to do this, right? And that really changed the case for these patients, right? This is a good point. When your back is up against the wall, you have to try something. So let me say this. When your back is up against the wall, you have to try something when it comes to patients. And that's what we did. I want you to do this one quick action to get a quick win. Find what areas where your patients need a little extra nudge in, like maybe medication, right? And figure that out. Maybe it's appointments, maybe it's general doctor recommendations, but find that one area that your patients need help in so you can center on that problem and get to work. So what did we do to implement our artificial intelligence program, right, for over 500 patients? Well, first, we made it multicultural, right? So that the AI can speak in the patient's native language to actually build trust. So why is that important? Well, there's a statistic that said in 2023, a study of 176 limited English proficient, basically they spoke Spanish, adults found that seeing a language coordinate physician produced a 7 percentage point increase in the patient's reported trust. We had to make sure that whatever patient we're talking to, whether they speak Spanish, Hindi, Mandarin, Cantonese, we wanted to make sure the text reminders or the AI reminder configuration we were building was being able to speak in their native tongue so that the patient felt a kinship to it, right? That's so important. That was just based on studies and data that we saw. Next, we made sure it tied it to a response to a previous action or non-action. So in this case, we tied it to make sure that the patient was already doing a blood pressure reading, right, or not. This is so key because if we didn't have that awareness of what the patient was already doing, it allowed our system to be more accurate in making sure, that just in time kind of reaction to the patient. Finally, we personalized artificial intelligence based on non-patient identifiable information. This is important, right? Because like we talked about before, if you want to lower patients' blood pressure reading, there had to be a why to that, right? For some patients, it was being able to walk again or spend time with their son and daughter, playing sports. But because they were always sick all the time, they couldn't do it. So making that why so personalized and infusing that with the text messages we sent out really helped increase the patient's compliance, right? We were actually seeing patients who were using the device at all using the device every day at the end of this trial period that we started. We went from roughly about 40% compliance to nearly 95% compliance when the patients were being sent these personalized text messages using AI in their own language, also based on their actions, and then also personalized. This is so key. There's a quote from McKinsey & Company, a large consultancy firm, that says data analysis as well as disciplined framework for thinking through options provide a helpful structure for making the decision. In my mind, a disciplined framework is simply a fancy way of saying to have a consistent thought process on how you're going to do anything. The cost of inaction can be worse. Elon Musk, CEO of Tesla, has said, if your competitor is rushing to build AI and you're not, they will crush you. That is a strong quote. But I will say this, healthcare is definitely not a winner-take-all market like what Elon is faced with. But he is correct in that patients will leave your healthcare organization for another one if they're not getting better care. Right now, the better care can happen with augmented by artificial intelligence. One of the things that we're seeing is I can just remember a time when we first started developing our solution set in the healthcare space. We first developed with an app that prevented what they call COPD readmissions, basically patients who have respiratory issues and difficulty breathing. So this is so important because in readmissions, what happens if a patient goes to the hospital and is discharged from the hospital, goes home, and then gets readmitted within 30 days, that is a huge penalty for healthcare systems. Matter of fact, this is such a big problem that healthcare systems are trying to avoid that. That includes hospitals, clinics. Reason why that's important, because if they get charged for these penalties, that means they have lower margins and they just won't be sustainable, especially in the rural health area, right? This is a huge problem. So in rural Georgia, we were working with a large healthcare organization to kind of help prevent these COPD readmissions. And the way we did that was we figured, hey, what if we can just implement something that was already out there? In this case, it was called COPD assessment test, or CAT. And patients, they just need a simple app to just remind them if they were having what they call an exacerbation, difficulty breathing, to remind them to take their inhaler. So with this simple app and technology implementing, we were able to reduce readmissions by 25%. This is huge because not only that, it saved tons of time, but also the patients who got in the habit of using the inhaler more and ultimately got better over time. I would tell you this, small digital technologies can have a big impact on patients' lives. Let me say that again. Small digital technologies can have a big impact on patients' lives. Hello, everyone. Welcome once again to Medical Practice Success Secrets. This is Theo Harvey, co-founder of SensorMed, a remote patient monitoring platform. I'm super excited about our guest today. We have Dr. Natalie Vander Rijst. How are you doing today, Dr. Natalie?
I am wonderful. The sun is shining, and for once, I'm not frozen in this tundra, so I can't complain.
Yes, I know. As we're recording this, a lot of countries still under ice and winter advisories. But yes, we are both happy for another day. When you kind of think about like, the advent of artificial intelligence and the importance of how it's kind of gathering knowledge from, the human knowledge database. What are your thoughts about that? In your environment, I know you're in a unique environment. It's kind of life or death decision making. AI may not be there yet, but are you guys starting to implement some of these tool sets, in the way you practice medicine at that level?
One, I love AI. I'm very excited to see what's going to happen with AI. To answer the question, yes and no. I, again, get to work with some absolutely brilliant people, for which I'm very grateful for. And there are a lot of active, ongoing research studies going on about utilizing AI in the ICU.
Mhm.
Specifically, what I can think of is when it comes to ventilators and the different tools, exactly like you said, that we use in the ICU, the blood pressure monitoring. How can we implement AI to take some of that burden off? I don't think it's going to replace us anytime soon, but to at least implement that and kind of ease that burden on those different tools that we get to use, which I'm very excited about.
I love it. Yeah, I mean, obviously, it's impacting everyday life. The challenge with artificial intelligence, as you're probably aware, it can hallucinate. Coming up with interesting examples and facts that are not even non-existent, which as you know, that could be critical and detrimental to a patient's care long term. So those are the things that we're seeing with AI. Are you guys using? We're seeing a big uptick in like medical scribes, AI scribes. Are you guys utilizing those where you're doing a case and you're kind of communicating verbally, as if you're writing down the case notes? Are you guys using that at that level yet, or is it still more verbal and written communication?
I have seen a lot of people use them, not necessarily intensivists.
Hmm.
I'm seeing my other colleagues see that. And I think the reason why, at least why I haven't implemented or looked more into it from an ICU perspective, is again, the complex nature of said patients. And not even the complex nature, but also just the fact that the majority of the patients we take care of aren't able to talk back to us. So using a scribe is a very different phenomenon, in which case I would be using it more for my plan. And I think exactly like you said, at this point in time, I would not trust AI to write me a plan. So I think
Yeah,
that's
and
why
just
it's not as utilized in the ACU.
yeah, just blindly following what it says would just not be advantageous. But you make a good point though. I mean, obviously at that level, patients are probably nonverbal. You're not getting a lot of feedback, so your guideposts are probably the data from the machines and from the monitoring equipment and things of that nature to kind of guide you in your plan. Is that how you're looking at it and approaching the problem?
With regards to like how the patients are faring,
Yes, that's correct. Yeah, to make your plan and kind of navigate the situation as you're dealing with from a critical care standpoint. That's correct.
I will definitely say yes, we use all of those tools and everything that we have attached to the patient and the labs. We definitely use to see how the patient is faring. That being said, even if the patient can't talk, there's a lot that a patient can tell them about themselves just by a physical exam.
Mm,
So we still definitely, I don't want to say utilize the patient, like it's coming out wrong. We definitely still interact with the patient. We examine the patient. And like I said, a lot can be said about a patient's nature and illness just from physical exam. But then, especially when combined with all the different tools like the ventilator, like the
mhm.
blood pressure monitoring cuff, and all those things, and as well as with the labs and images, of course, can
Absolutely.
go a lot. And that's also
No.
another way that I think AI is being utilized a lot more is when it comes to radiology. I've seen a lot more AI being used especially with CAT scans of the head, where it's kind of like you need to know quick answer, yes or no, is this a stroke? Yes or no, is there a bleed? It's very useful.
Yeah, I remember years ago, teleradiology took off, so the radiologists could do things, from home and kind of do things. But now with the advent of AI assisted radiology, I think that's something we're seeing more and more, up to your point, where they can kind of, make reasonable, great estimates. And obviously, what we're seeing with AI is, just in all sectors of not just healthcare, but just in general, they call like AI assisted, right? And so basically, or co-pilot, right? And so there's always a human, that's taking this data, but the human makes the ultimate decision. So I do feel like that's kind of where we're going with our AI integration with healthcare. Is just like, hey, yes, we got this information faster, but there's still a human that's just taking that one little beat to make sure before ultimate decision is made. Even in call centers, I don't know if you had that before, where you do a call center, you're calling for like, finding out about tickets or something like that, and you're on call, and then you're talking to someone, and they say, hey, this is AI. Can I help you? And then, so do you need a human to kind of, interact here, or I'll pass you to a human after we have a conversation. So I think, they're trying to ease people into the use of total autonomous artificial intelligence in our lives. So, interesting time to live in, I tell you. One last question. Yeah. Social media, right? We talk to doctors across the spectrum, pulmonologists, primary care, cardiologists, just the advent of the amount of doctors that are on social media and sharing their expertise. Maybe walk me through your journey of like, how did you start it, and what is the benefit you're seeing out of putting your expertise out there to a broader audience?
The way I started, I was on night float. Very sleep deprived. I'm pretty sure I was in like some type of 28-hour call. Very sleep deprived. I had a moment of sanity of like not needing to do anything. Opened the app, saw a funny song, and was like, we're posting this. So that's how I started. But I think ultimately kind of how it grew is, one, for me, I love making them. I love sharing. I love creating. So that's kind of how I got there. That being said, I think overall, I think there's so many benefits to having more and more physicians, healthcare workers on social media, especially now with TikTok dying, unfortunately, most likely. One, like I said, I'm from the Netherlands, so I didn't have anybody here in the States. I came here on my own. I didn't know how to get into medical school. I didn't know anything. I didn't know how to do loans. I didn't know how to do this. And I think that there's so many people like me, like people that have families that are doctors or friends that are doctors automatically have a leg up because they're like, you do this here, you do this here, you take these boards here. For one, getting into medical school, two, for going through medical school and getting into residency, and always that next step. So being on social media and having other advocates, one kind of showing you the path for, hey, listen, this is how I did it. This is how you do that. And having like surrogate friends and family members that are physicians to help you through that is such a resource. Combine that with, there's so much knowledge that you need to learn in medicine. It is unbelievable. The fire hydrant analogy, I don't know if you've ever heard that, but medical school is a fire hydrant. It's so true. You're just like, oh my Lord, why? How much more knowledge can I absorb? So having people not only like giving you more ideas for how to study better and how to study more effectively, and being like, hey, listen, these are the tools I used. Also, have you heard of this really cool mnemonic I came up with for you to memorize this better? Or even better, explaining something in basic terms, which unfortunately there's so many smart people and so many smart teachers. Sometimes they forget, being like, what is this basic knowledge? So having so many more people on social media and having so many more teachers because of that, I think is wonderful. And then ultimately, I think it's also so great for patient relations in general, because we get to hear so many more patient stories from social media and being like, oh, you guys are struggling with this. You guys are dealing with this. Okay, let me take that into my own practice, acknowledge the experiences you've had, and let me make it better for the patients that I get to take care of. And then also physicians that are more and more teaching patients, hey, listen, this is what this disease is. This is what this disease is. And for the first time, people that never would have thought to have looked something up or acknowledged that something is different about themselves, or even above and beyond that, have been said, oh, you're crazy for some sad reason or another, they now get to advocate for themselves because they have more data that is physician backed. And then also very passionate about how much more fact checking I think is on social media because more physicians are on there. They're like, listen, this is a fact that you've been told and this is not true. Let's get to the real nitty gritty detail and truth of it. So, long story short, I think that having more physicians on social media is absolutely wonderful. And I encourage people to continue to share their information.
Dr. Nikisha Rogers, how are you doing today?
I am doing very good. I'm excited to be here. Thank you so much for having me.
I think I read somewhere about like I don't know, maybe you know the statistic on this, but we lose muscle mass like every year as we get older and older. And so, I've been reading this book about aging and pace. I don't look at, but I'm in my late 40s, about to turn 50. So I'm looking at like, okay, do I need to gain muscle mass now so that,
Yes.
as I get older and it starts to lose a little bit more, I can still, do simple things like pick up my grandbabies and things like that.
Yeah.
So kind of talk to me about like, the importance of why you kind of created online courses, right? To kind of educating families about aging related medical concerns. How do you feel like, this digital education is really transforming how you practice medicine?
I think that, as we get older, just like what you say, we sometimes don't realize what's normal aging from what's like, that's not normal. So a lot of people, if you talk to them, they think, well, yeah, she's supposed to fall, or it's just a simple fall, or, that's just her memory going. That comes with age. We always say it comes with age, or, she's changed a little bit. She's more withdrawn. It comes with age. And in reality, no, those things do not come with age. So what we try to do digitally online and in our small workshops is work with small groups, with, churches, civic organizations, and try to get people together that are going through these dynamics, that are caregivers or seniors themselves. And we try to walk them through like what's important to them in their healthcare, how to pick I keep on harping on that because if you don't have a really good physician that you could connect with, it could send things in a different tailspin. So what
Yeah.
we do digitally is it allows us to do it, by Zoom, and so we have more engagement. And if there aren't people in a physical space, but what we're able to do is kind of go through module by module and just say, okay, first we're gonna let's start off at the basics. What is it that these people do? What are geriatricians, and why haven't we heard about this? If there's only 7,000 of these people, and then when we just discuss that, then the second thing is, do I need one of these people, or does my mom or my sister, or do I need them? My parents may not need them, but at least when I go through that stage, I know that they're available. And then what we do is once we find out, do you need one, how to select the right person for you, then I really like to explain to people like what's normal from what's abnormal in aging. Because a lot of times family members, when the person's finally admitted to the hospital, they're like, well, I didn't know something was wrong. I didn't know I should have called somebody. I didn't know that it was time to have help come into the home. So we walk you through what's normal from what's abnormal. And I'm a teacher at heart. I love teaching. My parents were teachers in the Bahamas. Shout out to them. So I always grew up around a chalkboard. So now it's not a chalkboard, but it's, going on Zoom. So I love to see people learn and I love to see people have knowledge. I'm a woman of faith. I totally believe without knowledge, you perish. I've seen the difference in my patient panels who, are reading, their family members are involved. They're active, they're asking questions, they're bringing me JAMA studies. I see that these are the people that are less likely to have an adverse event versus the other spectrum. And it's not their fault. Sometimes they have to work 2 and 3 jobs and they can't come to the visit. Or, they're in the sandwich caregivers where they're taking care of their own children and having to take care of their parents. So they just don't have the support. But I know what it looks like to see people on the phone, desperate, crying, Dr. Keisha, I don't know what to do. I'm the only sibling. It's 5 of us,
Yeah.
but these other ones aren't pulling their weight. And you could put us in any part of the world and you'll get the same. There's always that family. And my heart goes out to them because I know how it feels when you feel overwhelmed, you're frustrated, and then you start to make decisions that you necessarily would not have made if someone had told you years before, like, wow, if only I had known, I could have helped my mommy to plan.
Mhm.
So I'm big on education, and our goal is pick the right doctor, figure out what's normal from abnormal, and then let's start to figure out what could go wrong so we could make a plan to prevent that.
Yeah, I love that. Pick a plan. I'm definitely big into that and understanding that. One of the things that we're seeing with the advent of healthcare changes, telehealth, and remote care. I don't know if
Yeah.
you saw. There's some actual new CPT codes that are allowing for reimbursement for caregivers. So yeah, we can definitely share that with you. But because I know there's a lot of, like you said, older individuals who are also caregivers, right? So, like, they may have a older parent or older sister, right? They're caring for, and they're also
They
needing
need
help.
care too.
Yeah, and so yeah, CMS. I think it was like last year announced some CPT codes that allow for kind of like caregiving help and assistance in the primary care setting. So I can kind of send you those codes if you're interested in that.
That'd be
Um,
awesome.
yeah, because I think that's so important, especially as we're experiencing the graying of America, right? The baby boomer generation is getting older, People are living longer thanks to wonderful medications and surgeries. We're we're in the midst of the Ozempic revolution, so people are losing weight and helping
Yeah.
eliminate some of the obesity, chronic
Yes.
illnesses. So yeah, so I think any way we can kind of help those caregivers, I think is going to be
Yes.
important.
Definitely.
Speaking of which, we work with a lot of primary care cardiologists, nephrologists, pulmonologists in patients that suffer from these chronic illnesses, like hypertension, diabetes, COPD. And we kind of monitor them with these remote devices like a blood pressure or a glucose monitoring. What are your thoughts about this remote patient monitoring's role in kind of reducing emerging visits and improving chronic disease management for patients as they get older?
I think it's critical. I think with the whole AI revolution, I think this is right on time because a lot of you like for physical limitations, sometimes it's hard to physically get out to a doctor's visit. I know like when my sister and I schedule our parents' visit, we try to coordinate it where they go together. So if they have to do blood work. We're like, this is happening on the same day because we can't have you go in here and you go in here. So and they prefer that too because it's just too much on them to have to get up. So people have physical limitations, and then again, they can't get the bus. Sometimes I have patients who are like, Dr. Rogers, I want to come, but I have to make this appointment 3 days in advance. It's just too much. And a lot of times we miss when things change. So someone starts to retain fluid or their O2 sat starting to drop down, but no one's aware of it until ultimately, someone goes there and they're unresponsive. So I think what you're doing, and I'd love to talk with you more offline, but I think remote patient monitoring is something that patients need to know about. I think that families need to be aware of it and they need to be educated on, oh, does my parent benefit from this? How can we adopt this? How can we embrace this? And, get into a culture of bringing that information to office visits so that it could be a part of the assessments. So I think it's amazing.
Yeah, and we work with a lot of nephrologists, right? The old way of doing it was, to your point, creating a log and kind of logging that. But
Yeah,
because for patients who have, kidney disease, right, they suffer from hypertension is something they want to keep monitor of. Uncontrolled hypertension is a no-no. And so what we're seeing is now with these cellular enabled devices, they can take their blood pressure and it goes straight to the cloud and integrate it inside the medical record, right? And so the doctors are like, oh, I already see everything, right? And even remotely, they can change medications and help the patient kind of, and then the patient gets that peace of mind because they feel better connected to the doctor, right? So, oh, the doctor's watching my blood pressure. So if it does get unruly, I feel at peace. And so one of the things that we ran into too was, loneliness is a big factor part of that. And a lot of times when our nurses reach out to patients in rural areas, even or just even in city, a lot of times I may be the only person they spoke to that week. And so they are feeling connected to someone cares about them. And they usually see that as a social time to have a conversation with someone. And so I think, social isolation, healthcare, I think there was a big study on like longevity. They're saying social fitness, like, are you staying healthy and are you connected to people? Those two things help you live longer. And so, yes, the technology and all that is great and wonderful, but if it's helping bringing people together with connection, feeling like
exactly.
someone's seeing the data, we feel like that's really what this is about ultimately long term. So.
No, that's excellent.